Oh, the Honourable Parliamentary Secretary to the Government House Leader.
Mr. Speaker, I suspect if you were to canvass the House, you would find unanimous consent to call it 6:45 at this time, so we could begin the take note debate.
Do we have consent? I believe we have consent. Very good. Pursuant to order made on Friday, February 4th, 2022, the House shall now resolve itself into Committee of the Whole to consider motion number 6 under Government Business. La Chambre se forme.
The House will now go into Committee of the Whole.
Avant d'entamer le
Before we begin this evening's debate, I would like to remind honourable members of how the proceedings will unfold.
Speaking will be allotted 10 minutes for debate, followed by 10 minutes for questions and comments. Pursuant to order made Friday, February 4th, 2022, the time provided for the debate may be extended beyond 4 hours as needed to include a minimum of 12 periods of 20 minutes each. Members may divide their time with another member, and the chair will receive no quorum calls, dilatory motions, or requests for unanimous consent. We will begin tonight's Take Note debate. Accordingly, Ms. Bennett moves that the committee take note of the opioid crisis in Canada. Debate. The Honourable Minister of Mental Health and Addiction and Associate Minister of Health.
Thank you, Mr. Speaker. I will be splitting my time with the member for Yukon.
I am joining you today from the traditional territory of the Mississaugas of the Credit, where we honor all Indigenous peoples who canoed on these waters and whose moccasins roamed these lands.
Yukon for his unbelievable hard work and dedication, both as the Yukon's Chief Medical Officer of Health and now its Member of Parliament, to end the toxic drug supply and opioid overdose crisis in Canada. I'd also like to thank him for advocating so strongly for this important national debate to take place here in the House of Commons. Our hearts go out to all the loved ones and communities of those we have lost to the worsening toxic drug supply and to opioid overdoses. For decades, effective drug policy has had 4 pillars: prevention, harm reduction, treatment, and enforcement. Unfortunately, progress on harm reduction has met significant obstacles based upon ideology and not evidence. Our government is working with provinces, territories, and communities to develop a comprehensive, evidence-based strategy to address this ongoing tragedy. Over 20 years ago, Insight, the first safe consumption site, opened in Vancouver and continues to save lives. The evidence is clear. Harm reduction measures save lives. Since 2017, supervised consumption sites across Canada have reversed 27,000 overdoses without a single death on site. Communities across Canada now have increased access to life-saving naloxone, including remote and isolated Indigenous communities. Our government will use every tool at our disposal to end this national public health crisis. People are dying from toxic substances in the drug supply, and we will not turn the tide of the growing death toll until we address that reality. The pandemic has led to an even more uncertain and dangerous illegal drug supply, resulting in significant increases in overdose-related deaths. The provision of a safer supply of drugs is essential to help prevent overdoses and is a vital part of our comprehensive approach to the opioid overdose crisis. Our government's invested over $60 million to expand the access to a safe supply of prescription opioids. We also need to divert people who use drugs away from the criminal justice system and and towards supportive and trusted relationships in the health system. The Public Prosecution Service of Canada has issued guidance stating that alternatives to prosecution should be considered for social simple possession offenses. And my colleague, the Minister of Justice, has also introduced Bill C-5 to get rid of the previous government's failed policies that filled our prisons with low-risk, first-time offenders who needed help, not to be put in jail. This legislation would provide further space to treat simple drug possession as a health issue. Health Canada is also currently reviewing several requests from Vancouver, British Columbia, and the Toronto Public Health submitted for a Section 56 exemption under the Controlled Drugs and Substances Act to decriminalize the personal possession of drugs. Nous travaillons.
We are working closely with our provincial, territorial, and municipal partners, as well as other key stakeholders, like the impressive Moms Stop the Harm, with over $700 million for harm reduction, to save lives, and to give people the support they need based on what they need. Canadians can rest assured that fighting the opioid overdose crisis is one of this government's main priorities. We are going to continue to do everything in our power to save lives and put an end to this public health crisis. Thank you, Mr. Speaker.
Questions et commentaires, questions and comments. The honourable member for Courtenay Alberni.
Speaker, and I want to thank the member for speaking today. Mr. Speaker, 25,000 lives due to a poison drug supply have been lost in this country since this government got elected. Now, there was no mention in this in the speech from the throne. Nothing in the mandate letter to the health minister. It ranked 6th in the Minister of Health and Addictions. Now, Mr. Speaker, the courageous answer to this crisis is full decriminalization, regulated safe supply, record expungement, treatment on demand via public health system, prevention and education, all things recommended by her expert task force on substance use. Mr. Speaker, I have to ask the minister a question. Like, we've got applications from BC, Toronto, and Vancouver, who've had their request for Section 56 decriminalization exemption sitting on her desks since last June. It has had the formal support of council, public health officials, the Vancouver Police Chief, Adam Palmer. Hundreds of people have died in the city. Well, this government dithers. When is she going to give them an answer on their application? When is she going to put the expert task force's recommendations into place? And will she support an NDP bill, which is a blueprint, a roadmap for her to take action on this crisis that isn't a crisis, Mr. Speaker? It's an emergency. It's a national health emergency, and she needs to call it that. This government needs to act like it is, like they did with COVID-19. Where are they? Lives are at stake, Mr. Speaker, and it can't be about votes. This can't be about votes and getting reelected. We got elected here to do the right thing. And when it comes to saving lives, that's the right thing to do. She needs to act now.
Honourable Minister of Milton Health.
Thank you, Mr. Speaker, and I thank the member for his passion and for the private members bill that he's now tabled that we will be able to work on together. I look forward to being able to work on these things, particularly safe supply, as he knows that it is that at the moment the Public Prosecution Service has given guidance that people with small amounts of drug for possession should not be arrested, and of course but it is the toxic drug supply that's killing people. It is the need for safe supply, and I think that the $60 million that we've put into safe supply needs to be, in terms of those 17 projects, we need to do more. That's what I heard when I walked in the downtown east side, that it is going to have to be that people use drugs shouldn't die doing that. You cannot help people who are dead.
And comments, questions et commentaires. The honourable member for Central Okanagan, Similkameen Nicola.
Thank you, Mr. Speaker, and thank you for the Minister for starting off tonight's Take Note debate. This is a very serious subject in my home province of British Columbia, as was raised by the previous questioner. Mr. Speaker, in 2016-2017, former Minister of Finance, Bill Morneau, put in his budget $50 million every year and touted this as a new approach for dealing with opioids. Mr. Speaker, just break down the numbers, $50 million a year over each for 5 successive years, breaking down by 10 provinces and 3 territories. In places like Princeton, even more urban areas like Kelowna, do not show the resources of the federal government being fairly distributed, nor has this new minister, nor this new finance minister put in place a comprehensive plan to deal with this. Mr. Speaker, I have a question for the minister, and the minister is this. What have you done differently? Because people in my home province of British Columbia, especially during this pandemic, have suffered and their families have suffered. And I've been told time and time again there's not the resources and that no federal or provincial government cares about this problem. Maybe the minister can start off by addressing that.
The Honourable Minister.
Well, the member couldn't be further from the truth in terms of how much we have. This was my very first trip, was to go and learn from the people doing this life-saving work every day in Vancouver, listening to people with lived and living experiences. Then and what they are doing is saying that we have to move forward on safe supply. We have to get the ideology out of this and have pharmaceutical grade narcotics available for people using drugs. We had put $700 million into this program in terms of substance use and addictions, another $500 million in the platform. We will get this done, but it needs to be a comprehensive approach with all of the modalities and all the creative, innovative things that are happening across this country. They need to know that they have a serious partner with the federal government.
If I can have the honourable member's attention, I know we ran into a bit of a problem last night where we tried to get as many questions in as possible. I'm just going to ask the honourable members if they can be as concise as possible so that everyone gets a chance to speak, not only with the questions but also with the answers. Resuming debate, the honourable member for Yukon.
Thank you, Mr. Speaker, and thank you, Minister Bennett, for allowing me to share your time, and thank you for all you have done so far in your new role as Minister of Mental Health and Addictions. 2 days ago, Mr. Speaker, there was another burial in Yukon after yet another fentanyl overdose death. Not just a person, somebody's child. In the Yukon, mothers and fathers are burying their children. Children are losing their parents before they're old enough to know what's going on. Ces personnes ne devraient pas mourir.
These people should not have to bury their own children. Children should not become orphans because of overdoses.
Year so far, this month, 8 people died of an overdose in Yukon. I can tell you, the scale of 8 lives lost in rapid succession has sent us reeling and is enough to continue to lead the country by far in per capita deaths. We feel the pain of these deaths. We know that each of these deaths was preventable. For very complex reasons, a person took a single dose of a toxic drug and died. Died alone often. Died seeking a last high. Died without realizing that this high would be the last ever. Or worse, not caring because the high was more important than the risk of dying. In our small territory, we all know someone who has died or someone that is close to someone who has died. Opioids have struck in urban and rural settings, First Nations and non-Indigenous. The vulnerable and the known addicted have succumbed, as have successful sons and daughters, aspiring students, professionals, and elders. En témoignent les morts chez toutes sortes de...
All kinds of citizens have fallen. No class or race or category has been spared.
On some First Nations, recently Mayo, Carcross, citizens of the Vantak Gwich'in from Old Crow have been hit hard. People already grieving from pandemic strains and losses now have to endure the unimaginable grief of young ones lost to sudden drug-driven deaths. In Canada, we have lost more than 25,000 people to overdoses since 2016. Les opioids tuent 20 Canadiens.
20 Canadians per day are dying from opioids.
Medical officer of health back in 2016, when the first fentanyl fatality occurred in the territory. Since then, we have introduced many improvements in prevention and care, And much of our progress occurred thanks to the work of community partners and the support of Yukon's government, much of it through federal funding and support. In fact, if it weren't for the array of solutions we have in place since the onset of the opioid epidemic, better clinical management of addiction, increased awareness, take-home naloxone, harm reduction measures, this crisis would have been far worse. We've also had groundbreaking interventions, such as Kwanlundun First Nations Community Officer Safety Program that has saved lives in that community, a program that could be amplified around the territory. But we must do more. L'ampleur de la crise dépasse les efforts.
The scope of the crisis goes beyond the efforts that we have deployed. Opioid addiction needs a pandemic-level response.
Opportunity to share how this opioid crisis has touched our lives and our communities. It's an opportunity to share our concerns and our ideas of the steps we can take to address it. An opportunity to talk about best practices in Canada and around the world and consider where we can go from here. No single government or body can solve this crisis alone. We need all hands on deck, including the voices of people who use drugs, to continue to keep us honest. We need everyone, every level of government, experts in addiction medicine, harm reduction and mental health, community and Indigenous leaders engaged in a dialogue looking to address this crisis. Il faut parfois des changements.
Some will require legislative and policy changes, and the debate necessary to achieve those changes.
I look forward to participating in those debates in this House, and we need every option on the table. We must learn of this country to handle simultaneous crises. Like a busy global emergency ward, we no longer have the luxury of only one emergency at a time. What gives me hope is that we have successes around this country, and we have experts and evidence that tells us there is much more we can do to save lives and to protect our children. Please let us work together across the country and protect Canadians from a toxic drug supply. We can work together and we can save lives. Thank you, merci.
Thank you.
Questions and comments? Questions et commentaires. The Honourable Member for Kitchener Centre.
Thank you, Mr. Speaker, and thank you to the member from Yukon for your reflections this evening. For your leadership in this issue. This House is better with your contributions here in it. I wanted to ask with respect to the member for Courtenay Alberni, shared earlier his passion and the fact that he's put forward a private member's bill that would do what so many in this House have spoken of, which is to move towards this crisis being treated as it is, a public health crisis as opposed to a criminal justice one. And so I wonder if the member from the Yukon would comment on the openness for himself and potentially for others in the governing party to work with other parliamentarians on this bill to work towards bringing that to fruition. Thank you.
Member for Yukon.
Thanks to my colleague for that question and for highlighting the important private members bill from our member opposite. I do support the development of a bill that looks at the spectrum of the opioid crisis in the country, and looking at what policy options we should be looking at, including, as the minister referred to, the question of decriminalization and supporting people towards a safe supply. I had in my role previous as a CMOH talked many times to the subject of decriminalization and ensuring people have a safe supply when they're using drugs. So I look forward to working with the members on development of this private members bill. Thank you.
Questions and comments? The Honourable Member for Skeena-Bulkley Valley.
Thank you, Mr. Speaker, and thank you to my colleague, the member for Yukon, my neighbor just to the north. This is an issue that affects so many northern communities so profoundly, as the member indicated in his remarks. Now, there was a Health Canada expert task force on substance use just last year that issued a number of recommendations. And those recommendations are reflected very closely in my colleague, the member for Courtenay Alberni's private members bill, which seeks to decriminalize simple possession of drugs listed in the Controlled Drugs and Substances Act, provide a path for expungement of conviction records for those convicted of simple possession, and develop a national strategy to show the federal leadership needed in helping provinces, territories, and municipalities manage the harms associated with substance use. My question, does the member support those tenets? And can we stand together in this House and prevent the kind of needless losses of life that we have seen in all of our communities across the country? Will he stand with us?
The honourable member for Yukon.
I thank the member opposite and acknowledge the proximity and the struggles that the northern BC as well as the entire province is facing. I look forward to working with the members opposite on the, as mentioned, on the development and passage through process, including, I hope, with my role on the on HESA, on the Health Committee, that I might be able to see it reviewed and studied there. I believe that the tenets in the bill are important tenets to address the urgent nature of the opioid crisis in our country, and I think that this is an avenue for a way forward.
Resuming debate, reprise du débat, the honourable member for Edmonton-Wetaskiwin.
Thank you, Mr. Speaker. I'll be splitting my time with the honourable member from Central Okanagan, Similkameen Nicola. On April 29th, 2003, I got a call at home from my brother Dan. I remember everything about that moment. Exactly where I was in the house, the fact that I'd just finished an episode of 24, then in its second season. It was a beautiful spring day and there was a light breeze coming in through the patio door. I'd done an ab workout that afternoon for the first time in forever, and the memory of the physical pain from that workout is an odd remnant that will stick with me for the rest of my life because of Dan's next few words. Mike, are you listening to me? Are you listening to me, Mike? Dad died this afternoon. Our father, Mark, was 59 years old. The news was gut-wrenching, but it wasn't surprising. As a dad, my dad was absolutely wonderful. He told us he loved us all the time. He was free with hugs, kisses, and those regular I love yous, something that I didn't always appreciate growing up, but cherished as an adult. Not only did my dad not miss a single one of our hockey games, he almost never missed a practice. I could always count on seeing him with his trademark Grizzly Adams beard standing behind the glass by the net. I don't remember him without that beard. He started growing it right after I was born in 1969 and never, ever shaved it off. As an adult, he also had a perpetual beer gut. And like his father and his sisters, his hair was a beautiful snowy white. And he told me during our last conversation that he was finally embracing the idea of being Santa Claus during the next Christmas season. Quite honestly, he could have pulled that off when he was in his 30s. He never went to college, but he was one of the smartest people I've ever met. He was very sensitive and genuinely and powerfully connected with vulnerable people, I think because he could relate to them very personally. I believe my dad started smoking and drinking around the time he was 11 or 12 years old, and I don't know why. When he was 15, his father passed away, and at 16, he joined the Navy, likely a decision after a few too many drinks. He quit soon after when he realized he was prone to seasickness. Again, the drinking probably didn't help. About 15 years before he died, my dad quit drinking. And while he had difficulty breaking some of his other negative habits, his drinking had started to affect the family. And his love for his family was the one thing strong enough to give him the motivation he needed to quit. I don't know when my father was first prescribed OxyContin. It was probably sometime in 2002 or 2003. Old football injuries and years of carrying the extra weight had caused him to experience significant pain in his back and hips. I believe at first the medication helped, but I really don't know how much he was taking. We didn't then understand OxyContin the way we do now, but I did know my dad. Over time, something was changing. He seemed to be a little fuzzier, It's hard to describe, but he didn't look well over his last several months of his life. At some point, not long before he died, my dad decided he wanted to get off OxyContin. At times, those of us closest to him had gently let him know that we were concerned, that he didn't seem to be himself. He'd be a little defensive, something I was used to from my years trying to convince him to quit smoking. The exact timing of events in April 2003 is a bit foggy for all of us 19 years later, but I know this. We had a get-together for Easter around April 20th, 9 days before he died. My mom and dad planned to come separately. My mom arrived, but 2 hours later, my dad still hadn't shown up. I was worried enough that I drove 30 minutes to their house and went in, quite anxious and not sure what to expect, and shouted for him. I was relieved when he walked out groggily and said that he'd just fallen asleep. My brother and I debated this next part as we were reflecting the other night. I believe that my dad decided to try and get off OxyContin after that day and went back on it the night before he died. My brother thinks this might have happened earlier. What we agree on is that this withdrawal resulted in him being in agonizing pain. Dan tells me that he told him he thought he was going to die, something he also told me multiple times. The ultimate irony is that a couple of months after he died, when I received the call telling me that the cause of his death was a lethal dose of OxyContin, I was also told that the autopsy showed that, other than the OxyContin, his overall health seemed surprisingly good. His death, at least at that age, wasn't as inevitable as he thought it would be. After 19 years, my memories of my father are very good ones, and I'm so thankful that, as imperfect as he was my dad. But if I'm being honest, I also have some other thoughts, and I hope that sharing those thoughts out loud can help us find solutions so that others don't face similar tragedies in their own life. I wish that he'd not started smoking and drinking at such an early age. I wish that he'd been able to better manage his physical health, a driver of so much of his pain in his 50s. I wish that in his case, OxyContin hadn't been prescribed. And I wish that he'd had access to better tools and guidance when he tried to get off of it. Most of all, while I understand that stories are very powerful, I wish I didn't have this one to tell. That instead, my father could have known me as a member of Parliament, and one that he'd be incredibly proud of. I wish that we all had so few stories to share that a night like this, set aside in the Canadian House of Commons for this purpose, wouldn't be necessary. But all the wishes in the world won't change the past, and they won't change the current reality. It's way past time we took meaningful action to tackle the opioid crisis and other significant issues of mental health in this country. Mr. Speaker, tonight I have hope. Hope that one day people will speak about this as a time when their elected parliament set aside hyper-partisanship to find evidence-based solutions to a significant crisis. Hope that one day someone will talk about how the trajectory of their life changed for the better because of what we're doing here tonight. Friends, I am honored to be with you here now with the responsibility of turning this hope into action. Let's get to work.
Questions and comments. Questions et commentaires. The Honourable Member for Nanaimo, Ladysmith.
And thank you to the member for your speech. I first want to express my deepest condolences for the loss of your father. I was reflecting while you were sharing your story that it is clear that the opioid crisis does not discriminate. I've seen too many loved ones lost as a result of the opioid crisis, and in my work prior to becoming an MP in addictions, I saw it time and time again. I wanted to ask through the Speaker if the member would be in support of Health Canada's expert task force on substance recommendations. These recommendations were supported by police chiefs, health experts, substance users, frontline workers, and these recommendations were clear for full decriminalization, regulated safe supply, record expungement, treatment on demand via public health system, prevention and education. Could the member share with us today if he is in support of these recommendations put forward by experts?
The Honourable Member for Edmonton, Wetaskiwin.
Mr. Speaker, I am broadly supportive anytime we can bring experts together to discuss issues as important as this one. I think that we're at such a unique time right now in our parliamentary history. We've just gone through an election campaign where every single party had major promises and a lot to say about not just the opioid crisis, but about mental health in general. And I look forward to working with members on all sides to find common ground on the things that we agree on and move forward in a meaningful way that will save Canadian lives.
Questions and comments? Question from iPad. The honourable member for Spadina Fort York.
Thank you, Mr. Speaker. I want to thank the member for sharing his story. And I can say as a naval officer myself who does get seasick, we're still grateful to have had his father's service. As I noted in my question to the Prime Minister last week, opioids claim the lives of 19 Canadians per day. And sadly, my riding of Spadina Fort York has the second highest fatality zone of 57 deaths. But it's not just the one death. It's death by 1,000 cuts, 24,626 cuts. These are sisters, brothers, parents, grandparents, children, friends whose lives have ended too soon. 24,626 lives. And the number of deaths and destruction to our communities is staggering. And I saw this firsthand during a community safety walk with Toronto Police when they had to stop to respond to 2 overdoses then and there during our walk. So through you, Mr. Speaker, I would like to ask my colleague, what do they want to see in an effective national strategy, and when do you want to see it? Because we have to end this. Thank you.
The honourable member for Edmonton-Wetaskiwin.
Well, I think a few things. So first of all, one of the things that I think isn't talked about enough in this country is the concept of recovery. And I know for some people, there's all sorts of different connotation when you start talking about recovery, but I'll tell you, more than anything, I would love to have my dad here, able to be up in the gallery as I'm doing a different speech for this conversation, because he would have been able to recover. And I think that has to be one aspect of a strategy. But I think if we're going to have meaningful impact, I think members on all sides from all parties in this House have to be open to ideas that perhaps they haven't thought about before. I think that is absolutely critical. Doesn't mean that we're going to come to agreement on anything, but my hope is that we come together in common understanding that this is a major crisis that is costing those lives that the member talks about, and many more than just the ones we share in our personal stories. And if we're going to tackle a problem this big, we have to come together with minds open, with hearts open, with a common just vision and mission to save those lives.
Resuming debate, the honourable member for Central Okanagan, Smilkameen Nicola.
Thank you, Mr. Speaker, and it's certainly sad that I have to rise today because obviously I've risen in this chamber to speak to the same subject in 2019. The winter of 2019, we had an emergency debate on opioids. We're here again. We're here again. And I know there's going to be a lot of stories that we hear from very personal ones, like the one we just heard from my Conservative colleague. But I just want to note, Mr. Speaker, more than anything, this problem has not been solved. I asked the minister earlier what new improvements that she's made, and I don't get a clear picture. Maybe that falls on me, but we are still here. And we have some stories, Mr. Speaker, because in my riding, we have rural areas that have been forgotten about. Whether it be the flooding, whether it be on opioids, they need to be considered. So I bring a story today from my riding that many people may not want to hear. They may consider it partisan, but these are the stories that we hear. And I do hope that all members will listen and then hold me accountable if they don't like the story. But this is something I've been promised a father that I would tell. Unfortunately, this pandemic, Mr. Speaker, has already made a bad situation in my riding worse. We here in Ottawa in this place are partly responsible for that, and I'd like to explain why. I will never forget meeting with a father who wanted to share with me the story of his 19-year-old daughter. She was a recovered drug addict who had been clean for over a year. She was finishing up her courses to graduate high school. She had a part-time job. Her family were happy to have their daughter back. And then COVID came along. And I hate to say this, Mr. Serb, then came programs like the Canadian Emergency Response Benefit. Now, Despite living at home and being fully supported, this 19-year-old was able to apply and receive it. Sadly, receiving $2,000 a month with little expenses proved to be too much to handle. A relapse occurred and all the progress that family had made, that she had made, was lost. Now, I don't want to share the rest of the story because the details are too saddening. Not long after I met with the father, I heard from an RCMP officer who shared with me the frustration to be the first on the scene of a recently deceased individual. Their CERB check being freshly cashed and the balance of the funds after buying drugs was still in their pocket. This individual had died of an opioid drug overdose. And it's not just these stories, Mr. Speaker, shared with me personally. As the Penticton Herald reported in May of 2020, and the article is called Relief Money Refueling Opioid Crisis. Operators of the supporting housing facilities, places where people go to try to rebuild their lives, were quoted as saying, and I quote from that article, "The money has inadvertently refueled the pre-existing opioid drug crisis," says the operator of the Burdock House and Fairhaven social housing projects in Penticton. In some buildings, we've seen double overdoses in a day with the same person. And let me outline one particular quote, Mr. Speaker. And I quote, "But we also see people with such severe addictions that have no ability to emotionally regulate or behaviorally regulate, receiving what for them is a vast sum of money." Now let me pass on one more quote because this has to be heard. "We just emerged after a very challenging time working with this population with regards to the COVID-19 crisis. And now we're dealing with basically a financial windfall that has beset this population and is further compromising their ability to seek any form of recovery." Now, make no mistake, the CERB played a role in destroying these people's recovery, in many cases to tragically end their lives. Obviously, no one in this place ever wants to see that happen. Now, I'm confident when I say that all of us who voted in support of some of these measures did so at the time with the best of intentions. Unfortunately, what was not known to many of us, the exact manner this Liberal government would decide to deliver those. What safeguards we put in place to help and protect the most vulnerable, and now we know that there were none. As the operator of one supportive housing facility stated, and I quote, "None of the people living at this facility met the criteria for the CERB, but there was nothing preventing them from receiving it." Mr. Chair, I have more to say on this issue. I just point this out, that when we do things in this place, they do affect back home. I'd like to see the government tackle this with new policy. Many of the New Democrats, many Conservatives want to see the government change its approach. And I understand the government doesn't have the answers to everything. But I have to say, Mr. Speaker, let us first promise ourselves to do first no harm. Okay? And I appreciate that these stories are hard to hear. I look forward to hearing some more of these stories, Mr. Speaker, and I thank everyone for their kind attention to this tonight.
Questions and comments? Questions et commentaires. The honourable member for Victoria.
Thank you, Mr. Speaker. And the opioid crisis has ripped through families on Vancouver Island, where I live, in BC, and across the country. In British Columbia, since 2016, there have been close to 6,000 overdose deaths. Thousands of British Columbians, community members, family members, many of them young people like the woman the member spoke about in his speech. I've spoken to so many parents who have lost children. And as a new parent myself, it tears my heart to think about what that would be like. Most people don't even want to think about that possibility, but we have to talk about this. And health experts, advocates, even police are calling for a different approach to tackle the opioid crisis and the toxic drug supply. It's time to end the stigma, to save lives. My colleague from Courtney Alberni's private members bill echoes these calls. And I'm curious if the member agrees that the Health Canada Expert Task Force has recommended decriminalization and providing a safe supply. Does the member also believe that these are essential steps?
The honourable member for Central Okanagan, Similkameen Nicola.
Thank you, Mr. Speaker. And I appreciate the member for Victoria being a fellow British Columbian and someone who listens intently to their constituents. I promised this family I would raise this story today. And what I'm saying is whatever we do, let's make sure that what other actions we take here in this place do not add fuel to the fire. And as earnest as the member is from Courtney Alberni in his private member's bill, 2 years ago, we had a debate, and we're back here today. The government has a new minister responsible for addictions, and yet it's not the government that's producing new legislation. It's not the government that's doing this thing, it's other members. I would say, Mr. Chair, that for a comprehensive approach, a transformative approach, ultimately the government has to do something different. Then we can debate it out. And it shouldn't be up to private members to try and fix everything because they do not have an army of researchers and experts and lawyers who can help them to craft those changes. So the government needs to start actually putting in policy or start explaining why it's not working.
Questions and comments? Questions et commentaires. L'honorable député de Laurentides-Labelle.
The Honourable Member for Laurentides-Labelle. Thank you, Mr. Chair. What we're hearing is very moving. And I will share equally touching, moving stories in my remarks. I think that we're reaching a peak or a breaking point. It's so hard to hear my colleague. And, you know, I arrived in 2019, and yes, we are still having this debate. We still have this on the order paper now in 2022. There have been so many announcements and so many ideas. How is it possible that we're still in this position? What is the government, the current government, lacking, not doing? What don't they have? Why aren't they acting? How can we take action?
Yeah, thank you, Mr. Speaker, and I appreciate the member that she's here to share stories. But ultimately, I would just say in my home province of British Columbia, who actually put in place a minister for addictions prior, I think it was several years ago, and now the government has done, the Prime Minister has done the same with his own government in this new cabinet. You have two governments that say, we care about this. We have two governments that say, we understand the problem. We have two governments that say, but. They have to start answering the question. They can't just point to words. I know this is an opposition thing to say, because this government, more than any other government I've ever seen, is good at words, but very bad at actions. They don't explain themselves. Mr. Speaker, there's thousands of families that are without a loved one. This government just keeps saying, but. It shouldn't be up to individual members to be able to put forward legislation. I feel for the member from Port Alberni, Courtney Port Alberni. He's trying his best. But, Mr. Speaker, this government and the provincial government in my home province, they need to actually finish the sentence. They need to tell people, is it because they need to raise taxes, or is it because the changes they have are too controversial? But you know what, Mr. Speaker? We just need to have an answer and have more action if they really mean it.
Resuming debate, reprise du débat, l'honorable député de Laurentides-Labelle.
The member for Laurentides-Labelle. Thank you, Mr. Speaker. I have an awful lot to say, but I only have 10 minutes, so I will go off my notes. So today, we are talking about the opioid crisis, which affects all provinces, including Quebec. And the problem, Mr. Speaker, is that the long-term use of opioids can create tolerance, and we heard it earlier, that leads to higher doses and to opioid abuse. And we all have someone close who can be physically or psychologically affected and could end up suffering an overdose. The use of opioids as a general category has been growing since the 80s. Since 2016, the number of deaths linked to opioids have grown, have even doubled since 2016, from 3,000 to 6,000 deaths. 6,000 people have died. And Quebec, which was actually not as affected, has seen a rise in the number of overdoses in recent years. And COVID-19 has added to that increase in the number of deaths. It's a tragic thing, Mr. Speaker. We must take the time to ask ourselves whether policies and approaches to drugs here and elsewhere are effective. And so I would like to tell you a little bit about what has been done in Quebec and what is being done in Quebec, because it might be useful to our discussion. So the recommendations, and we heard this earlier, are to see it as a public health issue. So the plan that we have adopted in Quebec has a monitoring of people because, or of opioids, in order to look at what is happening and to see what the lay of the land is. So we have figures on deaths and hospitalizations as well. That's one part of the strategy. And then there are measures for prevention, overdose prevention. We say it again and again, because we want to reduce harm. Harm reduction is an important thing to think about and see how to provide universal free access to naloxone, to have it insured as well, to have medical insurance for that. Also for the first line workers, firemen, policemen, ambulance operators have it as well to be able to administer it. I would also like to underline the Dispensaire, a community organization in the right near my riding in Laurentides-de-Labelle that provides services to the entire region with Dr. Robert, he's legendary, Hugo Bessenet as well, and his team who provide information and who hand out naloxone kits that makes it possible to provide assistance to homeless people who need it. The use of naloxone in an overdose situation is a key element, and it's important to really know how to use it to be able to counter the harms linked to opioid use. In Quebec, Mr. Speaker, we have established guidelines for community organizations and health organizations and social organizations that want to provide supervised injection sites who use injection drugs. And this makes it possible to reach vulnerable populations and reduce the number of deaths by overdose, and to also reduce health risks, also reduce public nuisance problems, and take care of people who need it. In the Bloc Québécois, we believe that injection sites are a powerful tool, and we have the proof of that in Montreal. It's a powerful tool against the opioid crisis. And we really would ask that the federal government not create problems for the deployment of that tool. And we ask the federal government to give us other tools, because the work of organizations on the ground and health institutions have been priceless. Quebec has developed its medical practices to take into account the risks linked to opioid use, prescribed opioid use. Also, our research is another tool that we have to develop our response to the opioid crisis. Also with regard to social and health policies. Quebec is playing a determining role in this fight against opioid addiction. And health services are a matter of provincial jurisdiction, but the federal government can contribute positively. During the last campaign, I was told that the difference between parties nevertheless showed a consensus, an underlying consensus, that was that drug problems are a public health problems, and a lot of the parties were in agreement. It's a big step, and we have to move forward with that consensus. So we have to move forward with decriminalization. It is a very hard word to say, but decriminalization of simple possession. that measure should be accompanied by frontline health services. So what I am saying concretely is that this gives someone who has been arrested on simple possession to go get help and get either training or rehab or other health care in exchange for not having criminal charges pressed. So this measure exists in Montreal and in Nunavut, and we hope that we would like it to be available throughout Quebec. Once again, the key to success is in the funding. The Premier of Quebec, Mr. Legault, once again said that today. It is a well-known request by the province. I think we have asked this 152 times. And the Bloc Québécois is asking once again for an increase in the federal health contribution. 35% is what we're asking for, 35% of the cost of the system, $6 billion a year to be indexed at 6%. That is what we are asking for, 6% a year to maintain, I did say maintain, its contribution despite indexation and the inflation and the interrelation between the two. So the Bloc keeps coming back to this because we have a social project, one in which we have a universal, high-quality healthcare system that is worthy of a G7 country. And with that, we can address health problems linked to drug abuse and other health problems. I think I have just a minute left, Mr. Speaker, and I would like to thank all of the organizations like the Lise Beauchamp House in my region, which is a shelter that helps people get through difficult times, particularly vulnerable people who are homeless. And also, social housing is the basis here to provide access and power and to empower people to move forward. So you now have recommendations. You've heard them with regard to the funding needs. And when it comes to social housing, it's 1% of the annual budget to try to make up for the time we've lost since 1995. Thank you, Mr. Speaker. Questions and comments? The member for Rosemont-La Petite Patrie. Thank you, Mr. Speaker. I would like to thank my colleague for Laurentide Labelle for her speech and her very relevant comments, and for the work that is being done by a number of stakeholders in Quebec to address this major crisis. And we're talking about an overall crisis. Over 25,000 people have died in Canada in the last 6 years. That's about 20 people a day that we are losing. This is particularly severe in British Columbia, where there's 6 people a day out of a population of about 2 million people. So for people who have not had close contact with the impact of the opioid crisis, well, I would say you should perhaps look at the documentary Dope Sick, which tells us a lot about the origins of those drugs. But I have a specific question for my colleague, because I have my colleague for Courtney Alberni, who has a private member's bill, who is very specific that will help reduce harm by decriminalizing simple possession of drugs. And this is a measure that is supported by experts, that has been proven to work. And so it's not a legal problem. It's not a police problem. It's a health problem, a public health problem. And I wonder whether the Bloc Québécois will support the NDP bill. The member for Laurentide Labelle. I would like to tell my colleague that given the recommendations and the proposals we've heard, while we agree on the issue, that we agree that it's a public health issue, and we have to look at decriminalizing simple possession, and that's exactly what I said. So when it comes to supporting it, well, yes. If it's similar to what we have in Montreal, I think that we have to act quickly. So it will be our great pleasure to look at it so that in 2022 that we have another step here in this House that is crucial to move forward. Questions and comments?
For Spadina, Fort York.
Thank you, Mr. Speaker. I hope my colleague will forgive me for not asking my question in French. I'm not quite there yet. I'm glad that we're bringing up safe injection sites. I think, I want to localize it to my community of Spadina, Fort York. There are, as I'm sure my colleague knows, there are 38 in the country. Of the 38, there are 9 in Toronto. 1 is in my riding, and the surrounding 8 are in our very close proximity to my community. Safe injection sites are an important tool, as she says, but they're also not the end-all and be-all. And I think we also want to look further downstream too in terms of the impacts of what this crisis is having. The cycle of addiction and how it brings about homelessness and so many other challenges. Because there are 8 respite shelters in Toronto, and over half of them are in my riding. My community is bearing the brunt. And so I'm curious to hear from my member, through you, Mr. Speaker, what her thoughts are in terms of how do we break the cycle of addiction beyond safe injection sites?
L'honorable député de Laurent.
The member for Laurentides-Labelle. Thank you, Mr. Speaker. I'd like to thank my colleague for his question. Because before I was elected, I was a frontline worker in the 2000s. And my first realization was to see that when someone is vulnerable and has access to substances to get them through that difficult situation, I was witness that. So when I talk about being close to people and to give them the means to avoid them from becoming even more vulnerable, well, I think that that's something that requires social commitment in which a society actually gives itself the means for prevention, but also means to actually give vulnerable people what they need. In 2022, there are people in my office who go knock on doors, and they're not in that context. They're in a context in which the bubble and the inflation that we're subject to do not have enough money to pay for groceries and don't have enough for rent. So today, we have to focus on the distress that can lead to overuse or misuse of opioids. So I went through a number of steps earlier, but I am absolutely convinced that this year we will be able to get the necessary tools using all of the models that are proven to work, because I was there helping people and I did not have what I needed a lot of the time.
The honourable member for Victoria.
Merci, Mr. le Président.
Thank you, Mr. Speaker. I'm going to try a speech in French for the first time. So I would like to ask your indulgence. I apologize for any mistakes. Health experts agree with the NDP's call upon the federal government to use its powers under the Emergency Measures Act to declare a national public health emergency. That would make it possible for ministers of health to designate overdose prevention sites as emergency clinics. And this would also make them eligible for federal financing. The member across the way, does she agree with that? Mr. Speaker, I would like to congratulate my colleague for Victoria because her French was wonderful. And I understood very well, and it is wonderful to see that there are options that exist, because there is a model in Montreal, which is Dr. Robert's model, that is exactly that. It's about giving access to sites that make it possible not only for people to avoid tragedy, but also, and that's what I was saying before, but that can cover all different aspects of vulnerability. So I would like to congratulate you on your French, and I will at some point try out my English. Thank you. Questions and comments?
Seeing none, we'll move on to the next debate. Before we do, I just want to remind everyone to place their questions. I know this is an emotional and very heated or a very difficult subject. But please place your questions and your comments through the chair, not directly to each other. I don't expect any arguments to break out tonight, but it just keeps everything a little bit more in order. Resuming debate, the honourable member for Courtenay Alberni.
Thank you, Mr. Speaker. I'll be splitting my time with the good member, the MP for Edmonton Griesbois. Mr. Speaker, last year the government's Health Canada expert panel on substance use, 18 esteemed experts in this field, they came together. They cited in their recommendations in their report that bold actions are urgently needed, including decriminalization, the development of a single public health framework which regulates all substances, and the expansion of safer supply. This is in response to the 25,000 lives that are lost, Mr. Speaker. The task force was mindful of 5 core issues: stigma, disproportionate harms to populations experiencing structural inequity, harms from the illegal drug market, the financial burden on the health and criminal justice systems, and the unaddressed underlying conditions, Mr. Speaker. Now, the Prime Minister just last week agreed that this is a health issue and not a criminal issue. And he already told the nation before calling an unnecessary election that his government would be informed by the recommendations of this expert task force. Now, we heard this in May of 2021. We heard from the experts and were informed by its nearly unanimous recommendations. I urge all members to consider these recommendations, Mr. Speaker, which mirror the measures proposed in the bill that I've tabled, Bill C-216, which is a blueprint for truly health-based approach to substance use. We agree on all sides of this House to consider the advice of public health officials in dealing with COVID-19 pandemic. And it's time now to act on the experts about the overdose crisis, which is killing increasing numbers of Canadians from coast to coast to coast, 20 a day, Mr. Speaker. We continue hearing from medical health officers from all provinces and territories, including our new good friend from the Yukon who's been advocating to tackle this issue in our larger cities, from law enforcement, and from frontline workers who struggle daily to save lives in the midst of this overdose crisis. And we hear the same advice from those who with lived or living experience, those who've used illicit drugs or continue to do so because of many reasons, including trauma in their lives, poverty, homelessness, or addiction, and from thousands of family members who've lost loved ones. On Thursday, we'll hear from the Chief Coroner of British Columbia as she reports on the numbers of overdose deaths in my home province for 2021. And while I dread her report, Mr. Speaker, I welcome it as more overwhelming evidence to act. The expert task force recommendations are straightforward and common sense. They're evidence-based and rooted in the fundamental need to save lives. Harm reduction, Mr. Speaker. And first, the expert task force found that criminalization of simple possession causes harms to Canadians and needs to end. These aren't my words. They come from this body of esteemed experts gathered together by this government to guide the actions needed to save lives. It's been more than 9 months and hundreds of deaths since the City of Vancouver applied for a Section 56 decriminalization exemption with the support of its medical health officer and chief of police. This is the exact same process Vancouver used to get the first supervised consumption site almost 20 years ago. The federal government of the day backed the city against provincial opposition as the need was so dire. They took courage and political will like we need now. The need is more dire today if that is possible. But for whatever reason, the Vancouver application, now joined by applications by British Columbia, the City of Toronto, sits on the minister's desk. Now, secondly, the government was informed by its expert task force that, I quote, as part of decriminalization, criminal records from previous offenses related to simple possession be fully expunged. This should be complete, deletion, automation, and cost-free. And because those Canadians who are burdened with criminal records, Mr. Speaker, for simple possession of illicit substances, they often face insurmountable barriers to employment, housing, child custody, and travel. The bill that I've tabled calls for a national plan to expand access to harm reduction, treatment, and recovery services across Canada. Importantly, this must include ensuring low barrier access to a regulated, safe supply for users, instead of leaving the drug supply to gangs driven to maximize profits at the expense of lives. We must support the domestic production and regulation of a safer supply that is readily available to users. Now, unfortunately, as these common sense reforms are supported on a daily basis by public health professionals, law enforcement, the media, frontline workers, and substance users and their families, they've been given very little attention by this government. This overdose crisis isn't identified in the mandate letter for the Minister of Health, barely mentioned in the Minister of Mental Health Addictions letter, and nothing in the speech from the throne. I ask all members to this House to take the politics out of the overdose crisis. This crisis must be treated with urgency, slow-walking essential reforms through protracted political and bureaucratic deliberation, or worse, ignoring them altogether, will only result in more preventable deaths. Thank you, Mr. Speaker.
Questions and comments. Questions et commentaires. The honourable member for Thunder Bay, Rainy River.
Thanks to the member for Courtney Alberni for his words of wisdom. He seems to know a fair bit about this problem and seems quite passionate about it. So I thought I would ask him, and I don't know if he knows anything about this, but I know part of the problem with the opioid crisis is so many drugs are laced with fentanyl. And so people will be smoking what they think is crack, but it's laced with fentanyl. As a result, they have an overdose of narcotics and they die of the overdose of narcotics. Does he have any suggestion or know of any policy interventions that can address this problem? Thank you.
The honourable member for Courtney Alberni.
Great question. I really appreciate my colleague bringing that up. Not only do we have fentanyl on our streets, we have carfentanil. Carfentanil is 100 times more potent than fentanyl. It's 4,000 times more potent than heroin and 10,000 times more potent than morphine. It's killing people. People need a regulated, safe supply. People that use drugs, people that are addicted to drugs, otherwise they're going to die. That's what we're here for. That's what my bill's about, addressing that, a response to that. We need to decriminalize so that people aren't using drugs at home alone and not using harm reduction supports. But they also need access to a safe supply. It's time for us to have courage, Mr. Speaker, to not worry about just votes and getting reelected. We were elected to do the right thing, to save lives in a crisis like this. 25,000 lives in the last 6 years. I'm urging the government, I'm urging all members to come together, to listen to the expert witnesses, listen to the health experts, the police chiefs, the frontline service workers. This is what they're calling for. Thank you. Thank you for the question.
Questions and comments. Questions et commentaires. The honourable member for Vancouver East.
Thank you very much, Mr. Speaker, and I want to say a big thank you to the member from Port Alberni, in bringing his private member's bill forward. Vancouver East has actually been trying to raise this issue for many years now. In fact, I still recall the late Bud Osborne, who spearheaded the harm reduction approach and called for decriminalization decades ago. Van Doo, in my riding, has been very active on this issue, been continuing in pursuit of it. Mums Stop the Harm has been very active, highlighting this issue, but yet so many years later, the government continues to refuse to take action. And my question is this: why do you think the Liberal government refuses to acknowledge the lives that have been lost as a result of the opioid crisis, refuse to declare a national health emergency, refuse to grant the City of Vancouver the exemption that they're seeking, and actually bring forward a bill that will save lives?
The honourable member for Courtney Alberni.
Thank you, Mr. Speaker. I want to thank my colleague because she's been at ground zero of this fight from the beginning. They fought for Insight. Not a single person has died at Insight, Mr. Speaker, in 20 years. It's remarkable. You know, why? Because politicians are so worried about votes They're so worried about getting reelected instead of doing the right thing. That would be my answer. And I also believe that these lives don't matter to those politicians. It's got to change. And people are holding their politicians to account when they're ignoring expert recommendations from their own top public health officials, from their own police chiefs, from their own people, their own family members. No one's untouched by this, Mr. Speaker. No one in this country, especially in the province where I come from. And Mr. Speaker, not an MP in this House hasn't gotten the phone call from a constituent that's lost a mom or dad or a daughter or a son. Everybody's been impacted. And it's been 6 years, 25,000 lives. Why are we not responding in the way we've responded to COVID? Because we've demonstrated we can respond. And Mr. Speaker, I want to thank my colleague, and I'll work with her and all members of this House to move quickly, because 20 people are going to die today. Today, Mr. Speaker, and more tomorrow. And every day that we wait on implementing these common sense reforms, people will die.
Resuming debate, the honourable member for Edmonton Griesbach.
Thank you very much, Mr. Speaker. And I want to thank my honourable colleague from Courtney Alberni for his powerful statement, but moreover, his powerful actions. Thank you to that member for tabling this critically important piece of legislation, Bill C-216. This bill has the framework to finally address the drug poisoning crisis like the crisis it is, a public health care crisis. This crisis is killing Canadians, 20,000 in the last 5 years. This is truly an emergency and one the government can no longer ignore. This crisis affects all Canadians, but in particular, young people, Indigenous, Black, and people of color. This crisis is affecting Canadians unequally, and it is not by coincidence or chance. This is because of the long, historic, and ongoing violence and systemic racism that has existed and continues to exist in Canada today. Violence like the residential schools that existed just until 1996. Violence like the 60s scoop that tore apart thousands of Indigenous families, including my own. Violence like the government's ongoing apprehension of Indigenous children, and violence like the underfunding critical services such as providing clean water. Many of my fellow Indigenous people now live in urban centers, more than 50%. My district of Edmonton-Griesbach is home to some of the largest urban Indigenous populations in Canada, and this reality could not be more visible. What I and many of my neighbors see in community are the large number of folks living without homes, continually harassed and criminalized, and ultimately incarcerated, then thrown right back out on the streets with a criminal record, struggling to find housing, employment, and left feeling hopeless. Just this weekend, I was out in my community with a group called Boots on the Ground, handing out care packages, naloxone kits, coffee, and other much needed items. Within about an hour, we had given over 200 packages. I can tell you firsthand the need to address this public health care crisis in my constituency is great and it's urgent. This crisis falls directly at the feet of governments, both conservative and liberal, that have time after time ignored the calls to action by health professionals, Indigenous leaders, and harm reduction groups like Mom Stop the Harm and Bear Clan Patrol. You can't treat a public health care crisis with arrests and incarceration. Healthcare workers know this, substance users know this, my constituents know this. Groups like the Alberta Medical Association have said this. City councils in Alberta are calling for this. Decades of history and evidence from around the world show us the current approach of criminalization simply does not work. It only leads to more harm, more deaths, and Health Canada's own experts know this. Last year, their expert task force on substance use published a groundbreaking report about alternatives to criminal penalties for simple possession of controlled substances. Here is how their task force, which is made up of some of Canada's leading experts, describe the federal government's current policies in their own words. Quote, current public policies on substance use and criminalization, chief among them, are part of the vicious cycle that that is fed by and continues to feed inaccurate, stigmatizing perceptions of people who use drugs. Canada's current policies are based on outdated and deeply problematic positions, which the task force members reject. That devalues and dehumanizes people who use drugs by labeling them as immoral, addicts, or weak. Health Canada's experts don't hold back about the racist realities of Canada's drug policies. To quote directly from the report, quote, the legislation criminalizing drug possession is part of historical and ongoing structural racism and continues to have disproportionate effects on Indigenous and Black populations, which are more often targeted for prosecution for simple drug offenses, end quote. These are only two of the reasons why their task force unanimously recommended that Health Canada scrap all criminal penalties for simple possession. I want to conclude, Mr. Speaker, by thanking those on the front lines of this crisis every day, like Boots on the Ground Edmonton, Water Warriors Edmonton, the Bear Clan Patrol, and Mom Stop the Harm, who are shouldering the burden of this public healthcare crisis because governments refuse to do what is right. But this is our chance to rectify this, to undo some of that harm, to set a better path forward. Because governing is about choices. With Bill C-216, we are giving this House and this government a choice, an opportunity to listen to the experts, to do what is right, and to save lives. We can choose to end the war on drugs. And I urge all members of this House, whether government or opposition, to make the right choice and pass Bill C-216 into law. Thank you very much, Mr. Speaker.
Questions and comments? Questions et commentaires. The honourable member for Thunder Bay, Rainy River.
I want to thank the member from Edmonton, Brisbane, for his passionate comments on this subject. I know he, like I, has a riding which has a large Indigenous population, and I wondered how much he thinks the answer to the opioid problem is a matter of directly dealing with opioids, and how much of the answer is dealing with the underlying socioeconomic inequality, which I think is certainly part of the problem and fuels the crisis. Thank you.
The honourable member for Edmonton, Griesbach.
I want to thank my honourable colleague for that very important question. And really, it strikes the chord of the issue here, which is long-term historic and ongoing systemic discrimination against particularly Indigenous people have led to this unfair outcome. We've seen Indigenous people have been hit the hardest on these in the opioid crisis, in the mental health crisis, and even COVID-19. And so we have to address things like residential schools and the 60s scoop in order to actually get a true grasp on the issues facing Indigenous people today. Thank you very much.
Questions and comments? The honourable member for Kitchener Centre.
Thank you, Mr. Speaker, and thank you to the honourable member from Edmonton, Griesbach, for your contribution to tonight's conversation. I particularly appreciated your choice to quote directly from the expert task force on substance use and their report. I was curious if you'd be open to sharing more with this House with respect to recommendation number 7. And that is specifically that the task force strongly urges Health Canada to respect the sovereign rights of the Indigenous peoples of Canada and support their governments in providing appropriate prevention and treatment approaches. Would you be open to sharing your advice for parliamentarians on how to ensure that this is brought to fruition well?
Before we go to the honourable member for Edmonton, Griesbach, I just want to remind the honourable members to place their questions through the chair and not directly. The honourable member for Edmonton, Griesbach.
Thank you very much, Mr. Speaker. I want to thank the honourable member for that very good question. And in relating to how we respect Indigenous peoples is a matter of how we understand Indigenous people. And that part of the understanding is knowing that Indigenous people are on the front lines every single day, protecting one another, protecting communities, and doing what we can with the resources we have. And so when we make mention of the things the report can call for to do better, it's respecting that Indigenous people have a right to play in ensuring that this healthcare is, one, provided, and that the nation itself has the tools to deliver that service in a culturally appropriate way. So thank you very much.
Questions and comments? Questions et commentaires? The honourable member for Nunavut.
I'd like to thank the member for his powerful statement. First Nations Health Authority in British Columbia has shown that Indigenous people are 5 times more likely to experience an overdose and 3 times more likely to die than other residents. This demonstrates that Canada's colonial efforts to take the Indian out of the child, in quotes, continue to have impacts on the mental health of Inuit, First Nations, and Métis. We have also heard many times in this House about the over-incarceration rate that exists among Inuit, First Nations, and Métis. Could the member expand on how criminalizing drugs contributes to the ongoing cycle of violence that Indigenous peoples have suffered in Canada? The
Honourable Member for Edmonton Griesbach.
Thank you very much, Mr. Speaker. And I want to thank the Honourable Member from Nunavut. We have a lot in common. And part of what we have in common is our fight and pursuit for Indigenous justice. And when we think about what Indigenous justice in Canada looks like today, we cannot go any further than looking at our criminal justice system. We cannot do this right work without bringing those who are most affected along with us. And our nations are in pain. And this is no coincidence. It's the government's own doing through the Indian Act, in large part through discriminatory policies that look at Indigenous people as wards, and the existing policies that continue to harm Indigenous families like the CFS system. These systems are still in place today that continue to continually disenfranchise and discriminate against Indigenous people, resulting in their contribution to the cycles of violence that our people find themselves in. And these cycles of violence come with painful outcomes, our own family members.
Resuming debate, reprise du débat, the Honourable Minister for Indigenous Services.
Well, thank you, Mr. Speaker. Kwekwe, Oluktuk, Tanzi, hello, bonjour, bonjour. I'm sharing my time tonight with the member from Thunder Bay, Rainy River, and I'm joining you today from the Robinson Superior Treaty Territory. I'm actually on Fort William First Nation as we speak. Nous sommes profondément attristés et préoccupés par le nombre.
We are deeply saddened and concerned about the number of people who are undergoing the opioid crisis and tragically dying from overdoses.
Was in the midst of an opioid crisis, but the pandemic has made this crisis even more acute. And the reasons are many, but the results are devastating for so many people and families across this country. And all too often, it is Indigenous people that bear a disproportionate burden of grief in this crisis. Last week, I spoke with Chief Evan Yassi of the Saisi Dene First Nation following the tragic passing of a young community member. And Chief Yassi rightly describes the situation as an epidemic within a pandemic. In 1956, the Saisi Dene community was forced to relocate. What did that mean for his relatives? It meant leaving an area rich with tradition, natural foods, and safety. It meant being dropped off at a new location with less food, little to no shelter, and no way for the community to manage a looming and brutal winter. The community experienced this relocation trauma not once, but twice. And as Chief Yassi told me, many people died of exposure, of grief, of trauma. Their community is located in the far northern part of Manitoba with no all-season roads. Resources are flown in, and in the winter for increasingly few weeks, resources are transported on winter roads. The remote nature of this community means that gas has had to be rationed as they wait this year's winter road, and the rationing has had direct impacts on their ability to care for each other, to conduct wellness checks, to support each other. Mr. Speaker, despite these challenges and their most recent loss, Chief Yassi points out that like other Indigenous Inuit Métis communities, access to culturally informed mental health services that provide wraparound care and reconnection to culture in the land are critically important. And we talked about the fact that we can't find our way out of this crisis unless we reduce the demand, indeed the need for substance use as a way to self-treat deep and intergenerational trauma. It is our duty to acknowledge that the act of colonization through displacement, discrimination, and systemic racism has caused intergenerational trauma for Indigenous peoples, and that issues such as remoteness cannot stand in the way of doing everything that we can to reconcile. To reconcile, Mr. Speaker, means that we must move forward on equality, on truth, on self-determination, on services that are not Eurocentric, but rather designed by and for Indigenous peoples with sufficient funding and supports in place so people can access them. I'm someone who's worked on the issue of mental health and substance use for a long time, and I'm also someone who loves people who use substances, and I've lost a few. I'm critically aware that there is no one approach or program that can help. Prevention, for example, starts early, and it's things like decent housing and education opportunities and skills training and access to culturally relevant supports. It's making sure that kids get the best start they can. It's working across agencies, governments, and sectors. And of course, it takes all of us at every level, in every community, and it means that we help each other and we lean in to listen. My department is working closely with First Nations, Inuit, and Métis partners to improve service delivery. What does that mean? It means supporting better and more access to culturally grounded wraparound care. It means treatments with medications, traditional practices, on-the-land healing, case management, counseling, and aftercare. It means making sure that federally funded programs support organizations with flexibility to support people in ways that will help them stay connected. One of our government's first actions in 2015 was to restore harm reduction supports as a key pillar in addressing the opioid crisis. Madam Speaker, when someone dies of an overdose, it's too late. And we must do everything we can to help people stay alive as they work towards recovery. And Madam Speaker, recovery is possible. That's why another key element of our approach is collaboration. Everyone is affected, and partners in health, justice, and at every level of government must put people and families at the center. We must all ask, what more can we do to support people to find and stay in appropriate treatment, to support families and groups like Moms Stop the Harm, and to help each other get through this crisis together. Comme vous le savez bien, les traumatismes émotionnels.
As you know, emotional trauma must be understood and treated as a risk factor so that fewer people are abandoned. A crisis of this magnitude requires a response from all of society, including representatives from all levels of the community and governments.
I apologize, but we have to go to questions. Minister, the Honourable Member for Bruce Grey Owen Sound.
Thank you, Madam Speaker. Through you to the Minister. A report that was produced in my riding, the Community Drug and Alcohol Strategy for one of my counties, stated that mental health and addiction services are spread across many different ministries and funding bodies, both provincially and federally, and are significantly underfunded relative to the federal spending on physical health. Individuals and families seeking help to address mental health, substance abuse, and other needs such as housing are required to navigate a complicated system of supports and reconcile conflicting policies, information, attitudes, and options. And knowing the role for the minister as well with respect to Indigenous services and having two reserves in my riding, what steps is the federal Liberal government taking to consolidate responsibility in making access support easier for all vulnerable Canadians?
Honourable Minister for Indigenous Services.
Well, thank you, Madam Speaker. And the federal government has an important role to play in supporting provinces and territories to deliver on their responsibilities for healthcare, including mental health and substance use care. But also, beyond that, we have an important responsibility to provide in supporting First Nations and Indigenous communities to ensure that they have the right supports as they choose, and that they are appropriately funded, and they are designed and led by Indigenous people. We'll continue, Madam Speaker, to work with all partners to make sure that we can increase capacity for communities to support people who use substances and their families that love them.
Honourable Member for Vancouver Kingsway.
Thank you. The war on drugs is now universally regarded as an utter failure. It has wasted billions of dollars and hurt millions of people. We now know that criminalizing drug use and addiction not only doesn't work, it adds to the harm and actually makes things worse. Leaving the toxic supply of drugs to street-level criminals is literally killing thousands of Canadians every year. In fact, more every year that the Liberals have been in power since 2015. Given these facts, and the fact that the major source of criminalization is federal law, why won't this member's government respect the evidence and act now to decriminalize drug use, create a regulated low-barrier safe supply, and make prevention, education, and universal access to treatment the policy of her government?
Honourable Minister.
Well, thank you, Madam Speaker. And I think the member opposite knows that's exactly the journey we've been on, working with provinces and territories on making sure that people can access safer supply. In fact, just a few months ago, prior to me being the Minister of Indigenous Services, I was so pleased to announce funding for 4 safer supply projects in British Columbia. Of course, this relies on those strong partnerships with provinces, territories, and indeed the entire healthcare sector. We need to support providers to feel comfortable and safe to prescribe safer supplies for people who use substances. The federal government has been doing that in partnership with provinces and territories. And finally, I'll note, Madam Speaker, that in fact it is not one approach that is going to help save lives and stop this tragedy. It is going to be multiple approaches as appropriate, as determined by people and communities.
Merci beaucoup, Madame la Présidente. Thank you very much, Madam Speaker. In fact, for the past while, it's been an hour and a half, actually, that we've been talking about the various proposals that seem to be similar, just like all of us, really. I'd like to ask a question of the Minister regarding the process for decriminalizing simple possession, and also to the accompanying health services, frontline health services, that would completely change the situation. That would allow, through training or addiction support or other possible activities, make a significant change. I'd like to hear what she has to say, because in Montreal and in Nunavik, that's exactly what we're seeing happen.
Sure, for 20 seconds.
Well, thank you. There is a lot of work happening at various levels of government to consider decriminalization. And as I said earlier, in response to other colleagues, I believe that there is no one perfect approach, that it will be multiple things that will help people, who use substances, that will help their families. But the first thing that we have to do, Madam Speaker, and I fully agree with my colleagues in this regard, is that we have to treat people who use substances with respect and compassion. There is no path forward if we don't get that right.
Resuming debate, the honourable member for Thunder Bay, Rainy River.
Thank you, Madam Speaker. I'm happy to speak to this issue, an issue that I've been involved with one way or the other for about 30 years or more. As a long-time emergency room doctor, many of those years in Thunder Bay, but other places as well, I've seen a lot of overdoses. ICU doctors who work in Thunder Bay and also work in a lot of other places tell me that Thunder Bay is only second to Vancouver in terms of the number of people going to the ICU as a result of overdoses. A few years ago in Thunder Bay emergency room, we started to notice something different with overdoses. I remember someone coming in unconscious, and because of his pinpoint pupils and his slow breathing, I figured he was a narcotics overdose. And so I gave him Narcan or naloxone, and sure enough, he woke up. And after he woke up, he said, "What happened to me?" And I said, "You overdosed on narcotics." And he said, "No, I didn't. I was smoking crack." Madam Speaker, drug dealers have started putting fentanyl, and at times carfentanil, which is the veterinary drug equivalent, which is far stronger, into all kinds of other drugs. And so people are getting hooked on narcotics and overdosing on narcotics, not even knowing that it's narcotics that they're doing. Now, when narcotic overdoses make it to the emergency room, then they're usually okay. But a lot of people, unfortunately, don't make it to the emergency room. They're either pronounced in the house or they arrive VSA, vital signs absent. You try to resuscitate them, and unfortunately, you can't. But besides knowing about this problem from my position as an emergency room doctor, I'm also familiar with it from my personal experience. And I know a lot of people who either have family members, friends who passed away because of overdoses, kids who grow up without a parent because of an overdose, or parents having lost a child because of an overdose. I also know about this problem because going door to door in 2 successive campaigns, a number of people told me about people they lost usually their children. And I know as a parent, there's nothing worse than losing a child. Although I would say that certainly it's probably equally as bad for a child to lose a parent. I also know the extent to which drug addiction, mental health, homelessness, and crime are intertwined. Last year on the INAN committee on which I sat, we had several women tell us of the problem that Indigenous women from farther north communities have when they come to Thunder Bay and they meet some guy with flashy clothes and a flashy car who invites them to a party to try drugs. They try drugs, they get addicted to drugs, and then they're asked to go into prostitution in order to pay for the price of those drugs. Although our government has done a lot to address addictions, mental health, and the opioid crisis, I don't think we've been as successful as we'd like to be. But unfortunately, I don't know of any jurisdiction in the world which has been really successful in addressing this problem. As a doctor who spent a lot of years treating people with overdoses and hopefully maybe saving a few of them, I know that the fix I provided in the emergency room was a temporary fix. And people often would overdose again. So what is the answer? Now, as a longtime doctor, I think one of the most important things to say as a doctor is, I don't know when you don't know. And I certainly say, I don't know what the answer is to the opioid problem, but I do know that we need to do better. I also know that there are many people in Thunder Bay and Northwestern Ontario working tirelessly to find solutions on a case-by-case basis, and I really commend them for all their hard work. I would also like to make special mention of one group in my riding, a group who won't take no for an answer and have made it their mission to make a difference, and that's Team DEC. DEC stands for Dana Elizabeth Carl, who died due to an accidental overdose this past September. Her mother, Carolyn, and a bunch of like-minded, determined women established Team DEC with the goal of establishing a long-term addiction treatment program for women in Thunder Bay, both Indigenous and non-Indigenous. This project has a lot of support both in Thunder Bay and Northwestern Ontario. I think it's really great to see on the issue of the opioid crisis, all parties feeling passionately about this. Although we may have all different views as to what the best answer to this problem is, I think we'll hopefully can leave partisan politics aside and not let it prevent us from considering all options, because the only thing that really matters is preventing more needless deaths. Thank you.
The Honourable Member for Bruce Grey Owen Sound.
Thank you, Madam Speaker, and through you to the member from Thunder Bay, Rainy River. First, my thanks to all his work on the Afghan file over the last year and a bit. I know he's been a big advocate. I want to talk about solutions and get his take from another rural riding. Because in my riding in Bruce Grey Owen Sound, a harm reduction outreach pilot project called SOS, the Supportive Outreach Service, is underway in Owen Sound and Hanover in my riding. The project's a collaboration among various community partners and is operated through in-kind contributions from partner agencies. Our Grey County Paramedic Services has been instrumental in moving this forward. And the project provides wraparound health and social services to individuals who experience barriers to accessing traditional health services. And this project just began in October. It ends this April. And early outcomes show that it's quite successful in connecting the vulnerable community members to those necessary resources. So, in his opinion, would programs like this that are coming up with innovative solutions for, in particular, rural Canada, should the federal government be providing more support to them and more investment in leveraging the lessons learned from these type projects? Thank you, Madam Speaker.
Member for Thunder Bay, Rainy River.
I'd like to thank the member for his very good question, and certainly I do agree that we ought to be doing more for this. Now, I have to point out that, in fact, I think our government has done quite a bit in terms of addressing the opioid problem. Just since the pandemic, $4.5 billion top-ups in the transfer to the provinces, $100 million for mental health interventions for most of the most severely affected people by the pandemic, $500 million towards people suffering mental health problems, homelessness, and substance abuse, $66 million was announced in the recent budget for 30 new substance use and addiction programs. But absolutely, I think the real difference is made at the grassroots level. And it's all those people that are working at that level tirelessly to try to find a solution, where often solutions aren't easy to find, who really contribute the most. It's not just all about...
Questions and comments? Questions et commentaires? The honourable member for Edmonton Grisbach.
Thank you very much, Madam Speaker, and I want to thank my honourable colleague for his intervention and for making mention of two really important parts I'm hoping that he can make comment on. One wasn't sure about some jurisdictions that have done this before. Portugal in 2000 was one of the jurisdictions that did this, and we've seen some record results in making things safer for them, and we know those kind of results could exist here in Canada. In regards to the second portion of making sure we have a nonpartisan review of this issue and a nonpartisan solution, I think that's a really good and encouraging statement to make. My colleague from Courtney Alberni tabled Bill C-216. Would the member considering voting in favor of this important bill?
Member for Thunder Bay Rainy River.
I'd like to thank the member from Edmonton Brisbane for his comments and his reference to Portugal, where I believe they've decriminalized drug use. And certainly from what I know, as a result of that decriminalization, there has been some improvement in the problem in Portugal. So I think it's certainly an interesting case study. I can't say I know enough about decriminalization to give any definitive answer about it, but I do think it's something we ought to be seriously considering. As to C-216, I admit I haven't read it, but I look forward to reading it. Thank you.
The honourable member for Foothill. No, l'honorable député de Laurentides-Labelle.
The honourable member for Laurentides-Labelle. Thank you very much, Madam Speaker. So I have a very simple question for my colleague. Considering that he's got expertise in health, well, earlier I was talking about the kinds of interventions we could put in place to prevent overdoses, and the responses to overdoses is to provide universal and free access to naloxone. Since particularly in Quebec, firefighters, police officers, and others do use it to save lives. So I'd like to hear what my colleagues has to say regarding this free and universal access.
Rainy River.
I will try to respond in French. I'm not sure if I can provide a good one in French, but I do agree the solution to narcotics overdoses is naloxone, Narcan, and I think everybody in the emergency departments and emergency response field need naloxone, because that is the correct response to overdose problems.
The honourable member for Foothills.
Thank you very much, Madam Speaker, and I'll be splitting my time with the member from Kelowna Lake Country. It's unfortunate that I have to get up once again to speak about the opioid crisis in Canada, and it seems unfortunately that we're doing this on a fairly regular basis. And my colleagues will know that I'm not one to stand up here and talk about stats necessarily, that I try and focus on real stories and anecdotes. But the stats, especially for my province of Alberta, where we've seen the opioid deaths increase substantially over the last couple of years, and suicides as part of that. And just to put that in perspective, across Canada, there were 1,700 apparent opioid toxicity deaths between July and September of 2020. That is the highest quarterly number since we started measuring these stats in 2016. That is a 120% increase from year to year over that same time frame the previous year. There were more than 3,300 apparent opioid toxicity deaths, representing a 74% increase just between the 6 months of October 2019 and March 2020. That's 1,900 deaths. These are significant numbers, but yes, Madam Speaker, they are numbers. But those are friends, relatives, sons, daughters, mothers, fathers who we've lost. And I know I'm not the only one in this house. Many of my my colleagues and my friends have also had loved ones, friends, people who are close to them that we've lost through opioid overdose and certainly suicide. We knew this was a crisis going into the pandemic, but the pandemic has certainly exasperated the mental health crisis that we are facing in Canada, and as a result of that, the opioid crisis, which comes along with that. Over the past year, I had the honor of chairing a conservative working group where we focused on the opioid crisis and mental health. And we talked to stakeholders across Canada and around the world. And we were asking them, what is your insight, your advice? How do we address this? What are we missing? What tools in our toolbox are we overlooking? And there are a couple things that I want to share in my speech that I learned from those stakeholders, from doctors and nurses, counselors, and family members who had lost loved ones, and those who have been through opioid addiction and recovery. And the things that I learned from that, Madam Speaker, is there is no silver bullet. There's not one program that, as a federal government in partnership with our provinces and territories, that we can implement tomorrow that we know is going to resolve this issue, this crisis. So we know that this is not a one-size-fits-all. We have to have a suite of programs, a suite of initiatives that are going to address this crisis. But I think the most important thing is we need to do it now. And certainly we've heard some platitudes from the government, and I don't want to make this overly partisan, but we've certainly heard from many levels of government that we understand this is a crisis, but very few are actually doing something about it. And again, we've had emergency debates on this in the House in the past, and I haven't seen a lot of changes, and that is concerning. We can't carry on like this. But the one thing that we have heard is that the programs have been underfunded, and there hasn't been a true priority put on addressing the opioid crisis. But when I say underfunded, I don't think, and certainly what we've heard from stakeholders, is it's not a lack of funds that are going to some of these programs and initiatives that are out there. What is the problem is underfunding in terms of setting priorities. And one of the things we heard from just about every single stakeholder we spoke with during the last year and a bit going through this discussion was there is no metrics to measure which programs are successful and which are not. You could take the shotgun approach and throw money at just about every program that's out there, but unless you have a way to measure it, what is working and what isn't, you are wasting your time and money. And that's what we heard from so many of these groups is, it's not that we're lacking resources, but it's just there's so many programs out there, and some of them are working, and some of them are working exceptionally well, but some of them are not. And we want to ensure that those who are getting the funds are doing a good job, and it also empowers them to make sure that they're using the taxpayer dollar to the very best benefit. But another example that we heard from many of the stakeholders is why would you not implement a very simple, am I out of time already? Okay. I apologize, Madam Speaker, is the 988 National Suicide Hotline, where this would be a very easy solution that the Liberal government can do immediately. The House supported it unanimously. How can Canadians trust that the Liberal government are going to take this seriously if they can't even implement a simple 988 suicide hotline? Thank you, Madam Speaker.
Questions and comments? The Honourable Member for Beaches East York.
Thanks very much, Madam Speaker. And I know the member and I have engaged on this subject in the past here in the House. It feels a little bit like deja vu, and many more people have died since. And recently, in June, the Expert Substance Use Task Force recommended bold action on 3 fronts. And I don't think it's sufficient. I do think we need to expand treatment options. But we also know thousands of Canadians are dying because of a poisoned drug supply. And on an interim measure to save lives today, does the member support a safer drug supply, not as a permanent fix down the road, and we got to figure this out in terms of a long-term solution, but in the short term as a matter of saving lives today?
Member Foot.
I know I have the hardest writing name. And I appreciate we have had discussions on this. And the one thing I think that's missing from this, and I do appreciate what he's trying to say, and some colleagues have brought up the Portugal model, for example. But the thing that they forget to mention about the Portugal model where they decriminalize drugs is Portugal has invested substantially in treatment and recovery. The number of beds that they have for treatment and recovery far outweigh what we have here in Canada. So if we want to talk about decriminalization and safe supply, the first thing we have to talk about that must be in place first is a strategy and a regime around treatment and recovery and ensuring that we have the resources in place for those who are going to need it.
Questions and comments, the honourable member for Nanaimo, Lady Smith.
Thank you, Madam Speaker. You know, I was listening to the member's speech, and I do also agree that real stories are important, that we always bring it back to the people. And what we know is that in the last 6 years, 25,000 lives have been lost, unfortunately. We have seen years of conservatives who have been trying to discredit clear and overwhelming evidence that supervised injection sites save lives. So we want to talk about something that we can do. This is something tangible that we can do, is increase safe supply, increase harm reduction supports. Instead, we are seeing increased marginalization of those most vulnerable and criminalization of people struggling with substance use. I'm wondering if the member could please clarify, do you agree that we need to have these increased harm reduction supports in order to save lives?
Member for Foothills.
Thank you very much, Madam Speaker. I appreciate your question. And I hope she listened to my speech where I said there's not a silver bullet that resolves this problem. There has to be a suite of different programs, and harm reduction will be one of them. The issue that bothers me with this position is that harm reduction and increased safe supply is the one and only solution. It is not a solution at all. All you are doing is perpetuating addiction unless you have a focus on those programs that ensures that there is a way to divert people who are using those safe injection sites or supervised injection sites to recovery and treatment. And that is the key element that is missing in too many of these programs, where it is a perpetual cycle. You must be able to divert those people who need it into treatment and recovery, otherwise the cycle does not end.
La députée de Laurentides-Labelle.
The honourable member for Laurentides-Labelle. Thank you, Madam Speaker. I heard my colleagues say that you need oversight. I'd like to hear if these proposals will hold water. When you're talking about intervention for prevention of overdoses and harms reduction, activities for awareness raising, are all these good things? Improving medical and pharmaceutical practices with regard to opioids too. Access to integrated and adaptive services for people requiring medication to treat an opioid addiction. Evaluation, research as well. What does he think?
Speaker, and I want to thank her for her question, which brings up a very good point. First, the pharmaceutical companies who have been peddling these opioids have to be held accountable. When they were saying this is 90% that you will not get addicted is a ridiculous stat, and we know the consequences of that. Something that I would like to propose would be the establishment of a Center of Excellence of Mental Health and Addictions, where this would be the hub where these programs would offer or ask for funding. It would be funneled through there. We'd have that metrics of success, but it'd also be able to hold those pharmaceutical companies accountable and what should be out there and what shouldn't, and there are consequences in place if you are misleading Canadians on the addiction levels of the products you're peddling.
Resuming debate, the honourable member for Kelowna Lake Country.
Thank you, Madam Speaker, and it's an honour to be here in this late evening at this Take Note debate talking about the opioid crisis in Canada. Sadly, overdose deaths outpaced COVID-19 deaths in British Columbia last year. Constituents from across Kelowna Lake Country continually reach out to me on mental health and addictions issues playing out on our streets. But the opioid crisis also affects everyday families. And of course, the biggest tragedy is the people who are struggling with addiction and the people who are trying to help them. I've met with residents of Rutland and downtown Kelowna and other areas who see firsthand the tragic impact that opioid and other drug addictions have in their neighborhood. I've met with mothers who have lost a child to overdose, and their stories are heartbreaking, and I can't imagine what they have gone through. This government's continued response has been to push off the responsibility, and that has been left to our provinces and municipalities to deal with. There needs to be federal leadership on the opioid crisis here in Ottawa. I'm not new to this issue. I spoke about Kelowna Lake Country's addictions crisis in my first maiden speech during the previous Parliament. I called on the government to introduce actionable items that would deal with bringing those addicted into recovery while ensuring criminal accountability for keeping illegal drugs on our streets. Since then, I've told this government of families watching loved ones slip away of the desperate need to fund recovery and treatment centers and of the struggling surges in rates of overdoses in my community and my province. We keep hearing from the government what we've always heard of hearts going out, of action plans coming, of awareness, of moving forward. But there haven't been any specific actionable plans. Kelowna Lake Country and British Columbia are left to yet another year of tragic statistics. 2021 surpassed 2020 as the deadliest year for illicit drug deaths, and now 6 British Columbians a day are lost, according to BC's chief coroner. Kelowna has gone from counting drug deaths in single digits just 10 years ago to now many dozens a year in my community alone. I hosted a mental health roundtable in my community last year, and conversations veered towards talking about addiction. There were many stakeholders there from my community, and they gave really good input, which actually helped lead into our platform in the previous election. I've talked to first responders, and they are exhausted by the continual calls of overdoses and seeing the tragedy every day. Let us recognize and thank them here today. They are on the front lines of the opioid crisis every day. BC Emergency Health Services responded to over 35,000 overdoses in 2021, an increase of 31% compared to the previous year, and nearly triple the number it responded to when this government was elected in 2015. New substances with even more significant toxicity continue to appear in Kelowna, with a public health warning issued of a new substance just this past January. There are a number of organizations, including those in Kelowna Lake Country, who provide treatment and supportive living environments for those struggling to recover from addiction. They are also trying to bring hope and healing to people so that they can become productive members of society. However, many of these organizations do not meet government models to receive funding and have to self-fund by the community and rely on generous volunteers and donors. We need to use all the tools available, such as drug treatment beds and community recovery centers and wraparound services. The opioid crisis is a national emergency and an urgent health issue. COVID-19 has made things worse. People have been isolated, out of work, not able to see friends and family. My community has been very clear about what is needed to help them. The federal government has received clear recommendations from British Columbia municipalities, including Kelowna, while leaving them without much needed treatment. We must act for the people who need recovery and treatment, and act for the families and communities we live. We must all work together in this House to help people and families, and we must act now. Thank you, Madam Speaker.
Questions and comments. The Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Madam Speaker. Given that since 2017, supervised consumption sites have received 2.9 million visits, no death record to date on site, over 120,000 referrals to health services and 27,000 reverse overdose. Given these metrics, will she agree that our decision to approve 37 consumption sites since coming into office was a good one, and that we should continue on this way? Thank you, Madam Speaker.
For Kelowna Lake Country.
Well, thank you, Madam Speaker, and thank the member for her question. This is one tool in the toolkit, and really it's the only tool that the government has been using, both levels of government. And although it has been useful for many people and it has saved lives, we do know that, it's simply one tool, and there's so many other tools that we are not using. When you look at the numbers that I cited in my speech alone, you can see how the numbers are increasing. So it's not solving all of the issues, it is just one tool, but we need to be looking at all of the other options that are out there in order to best help resolve and solve the situation.
The Honourable Member for Longueuil-Saint-Hubert. Thank you, Madam Speaker. I'm delighted to take part in this debate tonight. It's true that it's a terrible crisis. The crisis is a matter of mental health, and when you're talking about health, you're talking about provincial jurisdiction. There are people here in Longueuil, in our streets, who want to meet psychologists. Why? Well, they can't. The service is underfunded. We need to increase mental health services. We need to increase the amount of availability. We could hire health professionals, nurses, and so on. We need to work with people who are who are facing these addiction problems. We need to increase the Canada Health transfers. This is a provincial jurisdiction.
Thank you, Madam Speaker, and thank you to the member for his question. One of the issues is that again, we have to utilize all the tools that are available, and they are provided through funding, but the federal government, can be a leader in that. This is one of the reasons why, on this side of the House, we have been asking to increase the health transfers to the provinces. And that's just one of the tools, and then the provinces can utilize the best they can. We also, have to look at national strategies that can be implemented across the country, so that there's some consistency as you go province to province. Thank you, Madam Speaker.
The Honourable Member for Vancouver Kingsway.
Thank you. I think we all know in this House that prohibition did not work to reduce alcohol use, and the war on drugs has not worked to reduce drug use. It's said that the definition of insanity is doing the same thing over and over again and expecting a different result. Well, that's just common sense, because to address a problem, one has to correctly identify the cause. Experts in addiction tell us that the cause of drug use and addiction is pain, it's trauma. So arresting and jailing and criminalizing, adding pain and trauma to drug users will never work. And it hasn't. So does the member think that criminalizing drug users and forcing them to purchase poison drugs from street dealers is something that this Parliament and her party should continue to allow to happen in Canada?
So much. The Honourable Member for Kelowna Lake Country.
Well, thank you, Madam Speaker, and I thank the member for his question. Well, if we want to back it up a little bit, and when you look at the cause, let's talk about the drug dealers that are out there. And right now we have a bill, legislation that's before this House that'll be looking at reducing sentences for smuggling for drug dealers. And so if we're going to back it up and look at where some of the causes are, let's start where people are getting some of these very harmful drugs from. And let's address it there as we're going through all of these other steps.
Resuming debate, the Honourable Member for Beaches East York.
Thank you very much, Madam Speaker. And at the outset, I'll be sharing my time with the member for Vancouver Centre. I also want to thank the member from Yukon for ensuring this Take Note debate happened. I very much appreciate his advocacy and the health-focused advocacy that he has. The sheer scale of this crisis is hard to fathom. We've lost 25,000 Canadians since the beginning of 2016. Every one of those is a personal story, of course, impacting many more in family, friends, and co-workers and loved ones and more. But it's not just opioid-related deaths. We should describe this problem as what it is. It is a poisoned drug crisis. A recent report from Public Health Ontario and the Drug Policy Research Network described it, I think, accurately, and we should all describe it in this way. This is an opioid toxicity crisis. And we know the laws on the books are ineffective. The police chiefs have told us the laws are ineffective, but it's worse than that. The laws actually contribute to these deaths because they push people away from treatment. We know that on the evidence. They stigmatize people, they push people away from treatment. But worse, prohibition is the absence of regulation. And when you leave it to the black market, what do you get? You get poison drugs, and those poison drugs are killing people. It is prohibition that is killing people. And we know that it's getting worse in the course of this pandemic. It was bad before the pandemic, but it is getting worse. And what's the answer? Well, I've heard colleagues say, we don't know the exact right approach. I've heard the Prime Minister say decriminalization isn't a silver bullet. And you know what? It's not a silver bullet. We need absolutely to do everything we can to stop the scale of death. And so let's listen to the experts. There's a recent task force, substance use task force, that included a police presence, that included a presence from mental health experts, included a range of different voices. And you know what they called for? Bold action for decriminalization, for a regulatory approach. Let's talk about regulating a safer supply and expanding that safer supply. Because you know what the answer to a poison drug crisis is? Ensuring the drugs aren't poisoned. Ensuring the drugs aren't poisoned. It is as simple as that, saving lives today. And decriminalization, not a silver bullet, but you know what decriminalization does? It ensures that we treat drug use as a health issue, and we encourage people to seek treatment. And so I worry when the Portugal conversation comes up, and by the way, Portugal still was probably more coercive than I would like, but if anyone wants to get up and support the Portugal approach, we should do that immediately because it would save lives. But it not only removes the stigma and encourages people to seek treatment, but in Portugal, they also wildly expanded treatment. And that's also what we have to do, but we don't do it in steps, not when so many people are dying. We do it all at once. So if we want to talk about Portugal, I would push back a little bit on my Conservative colleagues, because I would say Portugal decriminalized and they rapidly expanded treatment at the same time because they were facing a crisis. And you know what we need to do? At the same time, rapidly expand treatment options. There's $500 million promised in the platform that builds off $150 million from a previous parliament. We need to deliver that money in the budget and make sure it's evidence-based treatment. But that should go hand in hand with removing ineffective, not my words, the words of police chiefs, ineffective criminal laws that push people away from that very treatment we want to provide. And we need a safer supply because it is a poisoned drug crisis that is killing people. And don't listen to me, listen to CAMH, listen to the police chiefs, listen to the experts on the substance use task force, listen to every single expert who has looked at this issue with any seriousness to say what we are doing is killing people. Let's do something differently. And yes, let's do it all at once. This level of a crisis demands that we do everything we can all at once to save lives.
Questions and comments? The Honourable Member for Skeena-Buckley.
Thank you, Madam Speaker, and thank you to my colleague from Beaches East York for his comments and his powerful remarks. I've been deeply moved by the stories that the constituents of Northwest BC have shared with me. Heartbreaking stories about the loss of their loved ones, and particularly stories from parents who've lost their children. And they plead with me that we do something immediately in this House. And I heard that urgency in my colleague's remarks. My colleague, the member for Courtenay Alberni, has brought forward a bill that will come forward in this Parliament very soon for debate. And it represents some of the very solutions that my colleague has outlined in his remarks. My question to him, because I can't imagine that he doesn't support my colleague's bill, what will he do to work with us to build unity in this House and pass this bill immediately, as soon as possible?
The Honourable Member for Beaches East York.
Well, thanks, Madam Speaker, and thanks to the member for the question. I've jointly seconded that bill. I will happily support that bill. I will support any legislation that moves us closer to a safer supply, that moves us closer to an evidence-based approach that treats drug use as the health issue that it is. We don't treat gambling addiction with the criminal law. We don't treat alcohol addiction with the criminal law, yet we think a different substance, an illicit substance that is only illicit, by the way, because of past, I would say, racist policies directed at particular communities if you track back the history in this country. But we treat different levels of addiction very differently. And so I'm happy to support that bill, but fundamentally, we need this government to put more dollars on the table, and we need provinces to take those dollars and to follow the evidence.
Honourable Member for Foothills.
Madam Speaker, and I want to thank my colleague, and as he said, we've had lots of discussions about this, and I certainly appreciate his passion. But many of the members in this House continue to mislead a bit on the comments by the Association of the Chiefs of Police of Canada when they talk about their support for decriminalization. The one key to their statement was they would support decriminalization if police officers across the country had the resources to divert those who needed it into sufficient treatment and recovery, which doesn't exist right now. Would my colleague not agree that it is critical, if we are going to go down this road, for the chiefs of police and police forces across Canada to ensure that proper treatment and recovery beds are in place first if we're going to divert people into those programs?
The honourable member for Beaches East York.
So two things. I worked closely with the president of the Canadian Association of Chiefs of Police, Brian Larkin, to ensure that a bill I introduced in this House had their support. And by the way, that bill is now part of C5, and that bill has their support. So regardless of new spending, that bill will have the chiefs of police support, and I hope it has the support of my Conservative colleagues. It is my genuine hope that we rally across parties in this House and we do the right thing. And of course we need more money to expand treatment options. I would say I actually don't want police to be the first responder for what is fundamentally a mental health crisis in an individual's life. I don't think that's the appropriate response. So I think actually Portugal is probably too coercive, and Bill C5 is probably too coercive in that way. We should get police focusing on criminals and not focusing on people suffering from mental health problems. And so that ideally is the answer, but to your point, absolutely. We need much more significant funding to expand treatment options, and there's an area I think we can work together on.
The honourable member for Beauport-Limoilou. Thank you very much, Madam Speaker. All night we heard atrocious stories. We also heard various solutions. Just as my colleague was just saying, we also need funding, beds, really the funding and the education that needs to be provided to those who work with those people. And we also need interventions from when children are very young, with families. That takes a lot of money, but also a lot of willingness to go forward. But the topic that we are discussing tonight keeps coming back. Where is the willingness to move forward? When will people actually act?
So far be it for me to commend the government for certain action. But I will say on this particular crisis, we have seen significant action since 2015. We've seen an expansion of supervised consumption sites. We know that those save lives. We've seen significant hundreds of millions of dollars in funding, including to expand treatment options. We've seen a restoration of harm reduction as a central pillar of our drug strategy. My criticism is different. It's not to say we aren't taking action. Certainly we're taking much more significant action than past governments in this country. But the scale of the crisis, the number of people who are losing their lives, these are preventable deaths. These are preventable deaths if we change our policies. And so, yes, the government is acting, but is the government acting quickly enough, proportionate to the scale of the crisis? I think that's where the criticism lies.
Debate, the honourable member for Vancouver Centre.
Thank you, Madam Chair. I am so excited to participate in this debate because I think my colleague just said it all. We talk about a crisis. A crisis sounds like something existential. This is really, in my province of British Columbia, 6.5 people dying a day from preventable deaths. This is a mental health issue. This is a mental health problem. And there is a way to deal with it. We can talk about decriminalization. We can talk about a whole lot of other things. The only thing that would stop people from dying from a toxic, illicit supply of illegal drugs is a safe supply of drugs. And that's it. That is simple. Now, since 2015, we've heard from my colleague that our government has done a great deal of things. We have expanded safe consumption sites. We have been able to allow for everyone to have naloxone readily available to them for if they have a problem. But we've also learned some other things. I think what we've learned is that 70% of people, things have changed since this began. 70% of street users now inhale opioids. They're not using it intravenously anymore. They're inhaling it. And so we need to deal with that. We're finding out that about 35% of people who are dying from an overdose are dying in a private home. About 50% are dying in social housing and in hotels and everywhere else. Only about a small percent of people are dying on the street. This mythical figure we have of some homeless person lying in the gutter using opioids. This is not true. They're being used now. We know that. Clear evidence tells us that this is being used by professional families, by people with children, by middle-class persons. It is killing them. We need to stop it. I think our government has done a great deal. We've brought in, as I said, naloxone. We've been able to increase the number of safe consumption sites. We have been helping with field operations to deliver harm reduction across cities across this country. We've been doing all this, but we still find that the number of people dying each day is increasing. And I wanted to point out that no matter what we have to say about safe consumption sites, in the most recent report from British Columbia, there were no overdose deaths in safe consumption sites. There were 55% in hotels and single-room occupancy housing and in social housing, and there were 35% in private homes. So let's get this picture right. And the majority of people who are dying from it are men who are under the age of 39. These are people in the prime of their lives, productive Canadians whose lives are being lost, and we have it in our power to prevent it. And what we need to do is go safe supply. We need to look at how we provide the right kind of safe supply, though. Right now in Vancouver and in other places across this country, you can get intravenous drugs given to you in clinics, small clinics, which do not reach everybody. But if people are inhaling this, we need to be able to look at using a drug that has been used for 25 years in Europe. It's called a diacetyl morphine, or DAM. DAM has been used with success. People who are taking it are beginning to live productive lives. They're going to work. They're having families. They are doing normal things because they don't have to worry about dying. I think the most important thing to remember here is how do we get diacetyl morphine in Canada into the hands of people who need it? One of the big things that we find out is that provinces are unwilling to do this. They're afraid. The political risk for them is too high. And so we talk about decriminalization as if it's a magic bullet. It's got nothing to do with anything. And so what I would like to suggest is that the federal government has it in its power to use the substance use addiction program to deliver small amounts of money to pilot projects driven by clinical practitioners in their practices, physicians, by nurse practitioners through telehealth, and by other ways of getting inhalable diacetyl morphine into the hands of people. It's simple. It's an easy thing to do. It's clinically proven. It's evidence-based. So the outcomes are great in Europe, where they call it heroin-assisted therapy. Let us stop having ideology about this. Let's stop moralizing about this. Let's save lives, people. We have it in our power to do so. And if we allow for swap to be given to the clinicians who want to use it, to the nurse practitioners who can use it through telehealth, and to other ways of getting this out to real people, then we can save those lives. Thank you very much.
Questions and comments? The Honourable Member for Victoria.
Thank you, Madam Speaker. The toxic drug supply is taking lives. And, you know, there's been a lot of talk tonight about the Portugal model. They decriminalized the use of all drugs and unleashed a major public health campaign to tackle substance abuse, investing significantly in treatment and recovery, but crucially, they decriminalized. And ever since, drug addiction in Portugal has been treated as a health issue, as a social justice issue, not a criminal justice one. And I know the Member of Parliament for Beaches East York supports decriminalization. He just gave a scathing indictment of his government's lack of action on this issue. The member from Vancouver Centre just said that decriminalization has nothing to do with it. Experts disagree. The science disagrees. And I'm curious, when the member says that provinces are too scared to act, but her own province, my own province, is actually asking the federal government for an exemption so that we can have a safe supply, when Dr. Bonnie Henry, the public health official, is advocating for decriminalization when chiefs of police are advocating. How can she say this has nothing to do with it?
I have to give the honourable member for Vancouver Centre an opportunity to answer.
Decriminalization does have something to do with it. It removes the stigma. And we are already moving forward with that as a federal government. We have asked attorneys general who are federal in every province not to give a criminal record to people who are using certain amounts. The city of Vancouver is willing to do work on this. I am in support of it. But the thing that will save lives, which is what I'm focusing on tonight, is safe supply. And when you look at the evidence, Portugal, yes, has some success, but the greatest success are occurring in Switzerland and in the Scandinavian countries where they are using safe supply. And we need to recognize how people use it. It's not being intravenous anymore. It's being inhaled. And we see all kinds of people using it. We need to move forward to save lives. Decriminalizing is important. It's one of the many tools we have. But everyone is focusing on that, and nobody is really talking about access to safe supply. The federal government has been giving access to safe supply and has been funding safe supply in every province that have asked for it. The thing we are talking about is how do we get this inhalable drug into 70% of users, and how do we ensure that we are using a tried and true for 25 years drug that has been shown not only to save lives, but to get people starting up again onto rehabilitation, onto...
I have to give other members opportunities to ask questions. The Honourable Member for Edmonton Wetaskiwin.
Thank you. Madam Speaker, that might be the first time you've got my writing name right in in the entire time we've been doing this together. So much appreciated. It's a tricky writing name, to be fair. To the member, we're here again. We're having yet another debate on this issue, saying some important things and lots of great sentiment and what I'm interested in from the member, she's been a member of Parliament for a long time. She was a minister, I think, at one point in time. You would think she would have influence within her own party, and especially with her credentials. I'm wondering what specific action she can point to that her government has taken, and what demonstrable results those actions have resulted in to tackle this opioid crisis, because the numbers don't seem to indicate any action or any impact whatsoever.
Honourable Member for Vancouver Centre.
Well, I start off by saying that we actually opened up safe injection sites across this country, safe consumption sites, which actually were blocked and stopped for 10 years by the Conservative government. So that's the first thing we did. Secondly, we made naloxone, which can immediately save the life of somebody who is dying of an overdose, immediately to have it to help them not die. We have been giving the access to drugs with many provinces who have been able to accept it. The problem here is that it isn't reaching everyone. And I talk all the while with colleagues of mine who are also physicians who have been telling me that the thing to do is to use what is being successful for 25 years in Europe, in Switzerland and in Scandinavia, which is diacetyl morphine. It's an easy drug. And if my government, and I'm saying to my government, I've said this to people inside my government, because this is recently something that we've found out that we can do that's easily done, to give substance use and addiction funding program to doctors, nurses, practitioners, and others to be able to give this drug in its inhalable form and in its intravenous form to people who need it. That SUAP grant funding will make it happen, because right now in my province of British Columbia, that is not being allowed by the provincial government. So my friends may say...
We have to resume debate. And the Honourable Member for Mission Mascui Fraser Canyon.
Thank you, Madam Speaker. And let me just begin by saying that this is one of the most informed, incredible debates I've seen in the House of Commons since I've been elected. I'm going to be splitting my time with the member for Peterborough Kawartha. Let me just begin with a lot of the statistics I actually wanted to raise, and some of the points that I wanted to raise have been shared already. But I've been focused quite recently on the parliamentary budget officer when he said that we spent over $300 billion on COVID-19 measures since 2019 alone. And lurking beneath our ongoing public health debates is what we're discussing here tonight, and that is the opioid crisis, which is particularly bad in my home province of British Columbia. And I have to ask myself, and I've had this internal debate a few times throughout the last 2 years, imagine we spent just a fraction of what we were putting into COVID-19 to keep people home and directed those funds to some of the treatment options that have been shared here tonight. For the purposes of expediency, Madam Speaker, let me just raise a couple of points on First Nations. A 2017 report by the First Nations Health Authority and BC Coroner's Service found that status First Nations were 5 times more likely to experience an overdose and 3 times more likely to die from one. Some people within First Nation communities are continuing to use opioids even after receiving life-saving treatments 3 to 5 times through naloxone. Madam Speaker, this is devastating. Another area that requires some attention, and it was raised by the member of the last speaker from Vancouver Centre about the men. Men are disproportionately impacted in their 30s by this devastation and the opioid crisis, particularly, and I will add, in the BC construction industry. This is one of the largest employers in my province, and anyone who's ever worked in construction know that it's hard physical work, and workers often suffer a higher rate of injury on the job. But as it's also been discussed tonight, in this male-dominated industry, workers are statistically less likely to discuss mental health and substance abuse problems due to stigma. The impact of stigma on drug use is real. Fear of stigma prevents some people from seeking help. Labels like drug abuse or drug abuser, it dehumanizes how people are suffering and can impact the quality of care they might consider even accessing. So I think that's an important point to raise, is that we really need to look at the lens of the 30-year-old male that seems to be disproportionately impacted by this, and Indigenous people. Now, for the purposes of time, I called up a friend of mine, Jesse, who works for 5 and 2 Ministries in Abbotsford. They get lots of contracts with the province of BC, the city of Abbotsford, to deal with issues like the opioid crisis. It's important to mention in the context of treatment that we need to find hope, that people are only going to recover, based on what an expert's told me today, that people are only going to recover and get past this, despite the debate about safe supply and everything else, if people have hope and they have something to live for. And I think that needs to be part of any conversation we have today. Like my community of Abbotsford and my entire riding of Mission, Matsqui, Fraser Canyon has seen the devastation firsthand. My office is directly beside Haven in the Hollow. I just had a report that there was a death there the other day. There was also 19 naloxone treatments in 1 month. So in conclusion, Madam Speaker, I'm just going to propose and throw out some new policy ideas that might help and add to the discussion tonight. One, we need to do more to empower civil society. Imagine we gave tax breaks to Canadians that wanted to support a treatment center, similar to what we give to political entities in this country. In British Columbia, we've talked a lot about the other side of drugs, and that's money laundering. FinTrack, the ability of RCMP to stop the people importing illicit drugs into Canada, is not taking place. And that's one area where this Liberal government has not taken action to address the real and dangerous consequences of money laundering. And thirdly, Madam Speaker, we need to give more control to First Nations to address this issue as well. We need to give them more control over housing, and we need to apply culturally appropriate methods to address the opioid crisis. Thank you, Madam Speaker.
Questions and comments. L'honorable secrétaire parlementaire de la ministre de la Santé.
And thank you for to my colleague for his speech. The supply changes so quickly, people don't know what they get. There are also signs the street supply of fentanyl is being laced with far more potent opioid. I'd like to hear my colleagues comment on how important supporting safe supply is such an essential component of turning the tide on the alarming rise in opioid death from the toxic drug supply.
Honourable Member for Mission Mashpee Fraser Canyon.
Well, thank you, Madam Speaker. And regarding safe supply, I know for a fact when I spoke to Jesse at 5 and 2 Ministries today that his organization and other similar ones are often called by Fraser Health and told about this new illicit pill that's being passed around, and people can literally watch people be brought into hospitals who are having overdoses because our police officers and our Canadian Border Services agencies don't have the capacity to do their jobs effectively in the way they see it. I haven't completely informed my own opinion about the merits of a safe supply. I think in some contexts it might be part of the solution. Thank you, Madam Speaker.
Questions and comments? L'honorable député de Beauport.
The Honourable Member for Beauport-Limoilou. Thank you, Madam Speaker. The opioid crisis is a crisis that affects people for various reasons: mental health, pain, and our colleague explained that very well just now with the situation found among construction workers. They may have various serious injuries. That reminds me of a conversation I had a few weeks ago with someone who told me that now support programs for workplace injuries are costed or calculated by accountants rather than actuaries. Actuaries would see the long-term costs rather than the short-term costs and effects. I'd like to hear my colleague on this topic. Do you think that a long-term vision would be better for people in the construction industry who are injured? Madam Speaker, at the very least, we must provide the right tools to organizations who work with people who are impacted by opioids. I also believe that we must give more money to the provinces through the Canada Health Transfer to improve the situation. Thank you very much.
Comments, the Honourable Member for Vancouver East.
Thank you very much, Madam Speaker. And I thank the member for his comments as well. I know that whenever we raise the issue around needing to advance decriminalization and safe supply, people say that there is no silver bullet. Now, nobody ever said that this would be a silver bullet. We do need a whole host of tools. But first and foremost, I have to say this: dead people don't detox. We need to keep them alive. We need to save lives. And maybe there will be a process for them that one day they can embark on that would take them on a different path. So the question here for the Conservatives and to this member is this: will the Conservatives support the private member's bill that my colleague, the member from Courtenay Port Alberni, has tabled to decriminalize, and so that we can, in fact, start with saving lives?
Member for Mission Mashpee Fraser Canyon.
Well, I'd like to thank the member from Vancouver for her question. I haven't had an opportunity to review this recently tabled legislation, so I can't comment on a bill I haven't read. That said, the province of BC already has de facto decriminalization, yet the deaths and the challenges are still present. I'm not opposed to decriminalization necessarily, or even a safe supply, but I would need to do more research and look at the bill, and I would welcome a further conversation with this member if she would like to explain it to me in more detail. In good faith, I have not read this bill yet, so I can't comment. Thank you, Madam Speaker.
Resuming debate, the Honourable Member for Peterborough Court.
Here. Thank you, Madam Speaker. Cassie. She was a daughter, a sister, a friend. She met the intersection of mental illness and addiction, and the system failed her. Cassie's lifeless body was discovered at a local music store in my riding of Peterborough-Kawartha on Election Day, September 20th, 2021. Cassie was one of 17 people a day in Canada who die from opioid poisonings. She tried to get help, her family tried to get her help, but it wasn't there. Let's talk about the stats. In my riding of Peterborough-Kawartha, from March 2020 to December 2021, 75 people, including Cassie, died from an opioid poisoning, and 25 people died from COVID. How is our opioid crisis not a state of emergency? Our hospital in Peterborough has double the opioid death rate as the rest of the province. Double. We also have the highest unemployment rate in Canada and a housing crisis. These things are not exclusive of each other. We need a national plan. We need to look at the return on investment when we delve into prevention, treatment, and recovery. Right now, we are caught on a merry-go-round. EMS respond to an overdose call. They take the patient to the already maxed out and resource-depleted ER, and the patient is released only to overdose within hours or days, and the cycle continues. I want to share this message I received from a constituent. I don't have permission from the family to share his name, so I will call him Johnny. Johnny lost his mother and father to cancer within a few years of each other, then lost his small family to a breakup. He turned to the streets. He overdosed and was hospitalized for a bit. He overdosed again last month, except this time he sat in the ER for hours without being attended to. He was apparently kicked out by security for being loud, vulgar, and argumentative. He left on foot without a coat. His body was found in a local park the next morning. He froze to death. One of my favorite quotes is from Mr. Rogers. Anything mentionable is manageable. We cannot manage what we do not acknowledge. This pandemic has magnified an already mounting crisis. People cannot manage the stress of trying to pay bills, take care of kids, and losing their jobs. Mental health is physical health. You cannot separate the two. We need to change how we talk about mental health and addiction, and we need to change how we treat it. I have a saying, education equals awareness equals change. We can be the change, but we have to acknowledge what the opioid crisis is. It is a desperate attempt to escape from both physical and mental pain. Canada needs a government that will invest in offering recovery and healing. By definition in the medical world, opioids are prescribed to manage pain, and that is what they do. But it's not always physical pain the patient needs escape from. Canada has a chance to be a leader in how we treat pain. We have a chance to change how we help people heal. It won't be easy, and it will take time, commitment, and a lot more than just money to solve this. We need a cultural and policy shift in how we provide health care, but we can do it. We are ready. There is no effective strategy dedicated to the cause of the opioid poisonings. On a given day during my campaign, I would see EMS respond up to 4 times to an overdose call in the same area. How much is that costing? Imagine if we invested this money spent on resources to solve the problem rather than to react to the problem. We need to invest in complete wraparound services. We need innovative treatment and recovery healing centers that don't just manage the addiction, but look at the cause and manage trauma. We need to invest in the research to learn why someone turns to opioids. We need to evaluate how and when doctors are prescribing opioids. With the right intervention and strategy, Cassie and Johnny could have been more than another statistic.
Questions and comments? The Honourable Parliamentary Secretary to the Minister of Health. Oh, the Honourable Parliamentary Secretary.
Yeah, thank you, Madam Speaker. And to Cassie, much like the thousands of others, Canadians from all regions, that loss of life is significant and it impacts all of us, let alone the families and friends. And we extend our condolences. And the member highlights, as others have, the severity of the problem. And as I've been listening to the debate, one of the things that comes to my mind is that it's not just one government, one level of government's responsibility. That there's roles for the federal government provincial governments, municipalities, and nonprofit organizations, not to mention the valuable input our first responders have in this process. And I'm wondering if the member can provide her thoughts in terms of just how important it is as a communities, as a society, that we take a holistic approach at trying to resolve the thousands of deaths that occur every year because of this sad story.
Honourable member for Peterborough Court.
Thank you to the member. And I think tonight has been so emotional and profound for so many, because I think we all know this across the House, that this is a crisis. And I absolutely agree with what my colleague and member from Foothills had said tonight, that we do need a strategy. We can't have a shotgun approach. And before I came and spoke this evening, I messaged our chief EMS, our chief of EMS in my region, and he said the same thing. We need strategy. We need wraparound services. You can't have these single individual whack-a-mole for better term approaches. And we do need to come together, and we need a streamlined strategy.
Questions and comments, the Honourable Member for Longueuil. I have a very simple question for my colleague. Over time, we've put aside the building of new social housing units. Today, with the the harms that we've seen in the last 20 years, we hear that addiction and the use of opioids, and that's what I understand from the speech, is something that is caused by not having money, by not having access to health care, and one may end up homeless. I'd like to hear the honourable member if she thinks that we need to make up what's been lost or what hasn't been spent in the last few years. Is 1% enough to make up these decades of insufficient investment in social housing?
Thank you to my colleague for the question. I wish I could respond in French. Hopefully in a couple of years I will be able to, but not yet. My French isn't quite there yet. Absolutely. I mean, national housing strategy is a key partner. This opioid crisis, as we've heard tonight through many members, it's a web. It's a spider web of a multitude of factors that come into play. And it's like everything in politics. You need to address one thing to help another thing. And so often when I saw Cassie, who I spoke about in my speech, she didn't have a home. She didn't have a house. She didn't have anything to eat. And so managing that pain was often turning to addiction. So to get people in housing is a critical piece in managing the opioid crisis.
The honourable member for Nunavut.
Thank you to the member for Peterborough Kawartha for her thoughtful intervention. When former Prime Minister Stephen Harper made his apology for residential schools in 2008, the Conservatives acknowledged the importance of moving towards reconciliation with Inuit, First Nations, and Métis. The Health Canada Expert Task Force on Substance Abuse also recommends, in quotes, respecting the sovereign rights of Indigenous peoples in Canada to support their governments in providing appropriate prevention and treatment approaches. Does the member agree with the expert that funding of culturally appropriate prevention and treatment approaches is important?
Honourable member for Peterborough Kawartha for 15 seconds.
Thank you so much to the member for the question. She is absolutely right. And when we launched, one of the reasons why I chose to run to be an MP was for our strategy. And we will provide, this was in our campaign, we will provide $1 billion over 5 years to boost funding for Indigenous mental health and drug treatment programs. So absolutely, to answer your question, yes.
Main debate, the honourable member for West Vancouver, Sunshine Coast, Sea to Sky Country.
Thank you, Madam Speaker. I'll start by mentioning I'll share my time with the member from Parkdale High Park. 2021 became British Columbia's deadliest year for overdose deaths, with 1,782 people losing their lives, with 2 months' worth of data still to come. In October alone, there were 201 deaths, which roughly equates to 6.5 a day. But behind each and every number are beloved sons and daughters brothers and sisters, mothers and fathers, and the family and loved ones that they leave behind. And I want to take this opportunity to honor two parents from my riding by telling the stories of their late children. First is the story of Annie and her son, Alexander. Alexander was an athletic and creative soul who loved his family deeply, especially his daughter Bella, but he'd experienced several traumatic events in his life, including the murder of his best friend. As a result, he struggled with anxiety, depression, and PTSD. After a car accident, he was prescribed Oxycontin by a doctor, but his struggle with mental health left him vulnerable to addiction, and he became dependent on it. But despite this, Alex managed to stop using by himself in 2016 and was able to maintain his sobriety until the pandemic hit. But unfortunately, Alex died on January 18th, 2021 from carfentanil and benzodiazepine poisoning just days before his 29th birthday. Alex died locked in his bathroom floor alone, trying to hide his addiction. His death left a hole in his family as his mother, Annie, loses her only son and his 8-year-old Bella loses her father. Equally tragic is the story of Clint. Clint was a kind and successful young man who had a loving family and was just about to move in with his girlfriend. Clint had managed to score his dream job and went out with his friend to celebrate. His friend brought cocaine, which Clint had never used before. Because he was celebrating, he decided to take some. Later that night, he died. It turned out that the cocaine had been cut with fentanyl, and Clint overdosed on a drug he didn't even know he was taking. The loss of Alex and Clint are unimaginable tragedies, passing the prime of their lives, leaving behind loving families and promising futures. But these stories are all too common in British Columbia, where you're hard-placed to find someone that's more than a couple degrees removed from such a tragedy. Since the loss of her son, Annie is driven to make sure that others don't have to go through the same thing that her and her family have been through. Through her work with Mom Stop the Harm, she's fighting to make sure that we end the stigma around addiction and ensure that those who need it can get the help and don't take tainted drugs. And I want to thank Annie for her work and for Clint's father, Al, for their advocacy, and to tell them that we're listening, but we have much more work to do so that those who are struggling with addiction can get the help that they need. When simple drug use no longer needs to be concealed out of a fear of criminal prosecution, government programs that provide for safer supply are possible, and we create the space for treatment to rehabilitate those that are suffering from addiction. And this method has shown success in communities across my riding, and they have overwhelming community support. In February of 2021, an overdose prevention site opened in Squamish, and in Sechelt, the Sunshine Coast's first sanctioned safe consumption site was established in July of 2020. There, trained staff provide support which includes access to naloxone, counseling, overdose response and education, drug checking, and detox treatment options. These facilities work, as despite record high opioid deaths, not a single person has died at a supervised consumption or overdose prevention site in BC. And we need to support these sites that keep people safe, particularly in communities where Indigenous people are disproportionately impacted by the opioid crisis. We need to build on the $200 million investment in substance use prevention and treatment services for First Nations and the $116 million investment through Budget 2021 to fund projects through the Substance Use and Addictions Program. But we also need to ensure that those who are suffering from addiction are able to get the help they need without fearing prosecution. Addiction must be recognized for the health issue that it is and not be treated as a criminal issue. Our government has proposed taking steps in this direction with Bill C-5, which will require police and prosecutors to first consider diverting people to treatment programs and support services instead of charging and prosecuting them. Preventing avoidable deaths needs to be the fundamental priority for our country. This starts with safe supply projects, including overdose prevention clinics and the financial tools with the Substance Use and Addictions Program. We have to work with jurisdictions that are ready when they're ready. But we also need to work directly with physicians to give them the tools that they need to prescribe life-saving alternatives. We will continue to work towards ending this crisis so that nobody else has to suffer the loss the families of Alex and Clint have endured. Thank you, Madam Speaker.
Questions and comments? The Honourable Member for Sherwood Park for Saskatchewan.
Thank you very much, Madam Speaker. I thank the member for his speech and for the stories that he shared. I wanted to ask him about accountability for some of the companies that have been responsible for, in some ways, causing and certainly fueling the opioid crisis. There's been a lot of litigation in the United States targeting Purdue Pharma, the Sackler family, as well as McKinsey, and they've been forced to pay significant amounts of money that have been able to be used towards compensation for victims as well as treatment. Now, my sense is that in Canada we've been far behind in terms of the government trying to hold some of these corporate bad actors accountable for fueling the opioid crisis, for pushing misinformation about the addiction risk associated with opioids. And as one of the stories the member shared shows, most of the people who struggle with substance use disorders in the context of opioids started with prescription opioids, and for many people that was at a time when there was so much misinformation that was aggressively, pointedly pushed by some of these companies about these risks. So I want to ask the member, why isn't the government doing more, and should the government do more to hold these actors, Purdue, the Sackler family, and McKinsey, accountable?
The honourable member for West Vancouver, Sunshine Coast, Sea to Sky Country.
Thank you, Madam Speaker, and I also want to thank my honourable colleague for his question. I absolutely believe that we need to hold such companies accountable for their actions, and as he mentioned, one of the stories I brought up was the addiction started from a pharmaceutical drug that was prescribed in that vein. But I also would mention that it's not up to government to direct those prosecutions. That happens through an independent service, through the Public Prosecution Service. But while we need to really focus on that, and we need to ensure that there is justice there, we also need to take the steps right now to ensure that we're dealing with this as the crisis that it is, and that is some of the things that I mentioned in my speech, like having more safe supply and making sure people get the treatment that they need.
L'honorable député de Berthier-Masquinongé.
The honourable member for Berthier-Masquinongé. Thank you very much, Madam Speaker. I'd like to thank my colleague for sharing his time. Listen, everything we've been hearing has been very moving. We could spend days telling these stories. In this House, our responsibility is to administer and to propose avenues for action. I was pleased to hear my colleagues talk about decriminalization and that his government continues to want to do so. The Bloc Québécois will support them 100% when we're talking about supervised injection sites and supervision. Further to that, that is more under the provincial jurisdiction. We know that the health services take a lot of money. Also, affordable housing, social housing. There are direct links with the lack of social housing and all these problems. I'd like my colleague to explain first how he feels within being with his government inaudible while there are so many urgent and multiple needs. Can we count on him to try to put pressure on his caucus so that transfers to provinces will be increased?
L'honorable député.
The honourable member for West Vancouver, Sunshine Coast, Sea to Sky Country. Thank you, Madam Speaker. And thank you to my honourable colleague for his question. I agree that we need to invest in affordable housing. We started programs such as the Rapid Housing Initiative, which will lead to much more affordable housing. I think that's important, and we need to do more of it. This will help the people who need housing most. And if we don't have programs such as those ones, they will be, or they will perhaps be led down paths that may lead to this opioid crisis.
Speaker, and I want to thank my colleague for his speech. And Madam Speaker, one thing that he talked about was, and I was glad to hear him say it, that this is a health issue, not a criminal issue, and he recognizes that. However, in this country today, it's still a criminal issue to possess personal possession of drugs. And so, Madam Speaker, I mean, we heard this from the MP from Vancouver Centre. She said the same thing, that police aren't enforcing. But I'll tell you what, like, people who use drugs are worried about their drugs being taken. They're not getting harm reduction supports. Why are we here? Because people are using drugs, and it's a poison drug supply. So they're not getting out and getting the help they need. And Madam Speaker, people are dying. It's a war zone right now, you know, in many communities. And so I ask you, Madam Speaker, he says when communities are ready, British Columbia is ready, our home province. Him and I share that province. They've asked for an exemption. The government hasn't responded. Vancouver, it's been like 7, 8 months, Madam Speaker. It's still sitting on the desk of the minister. Does my colleague support decriminalization or not?
Member for West Vancouver, Sunshine Coast, Sea to Sky Country.
Thank you, Madam Speaker. I also want to thank my colleague for his question and for his advocacy and action in this space. I think some of the things he mentioned on the Section 56 applications for an exemption, I know that our minister is looking at that very closely. There are some questions about the quantum of the two proposals that really need to be discussed. Because it's important that we do this right. A lot of folks have also mentioned that at the same time of pursuing such a strategy, we need to make sure that there's appropriate treatment facilities in place at the same time.
And we have to resume debate. Resuming debate, the Honourable Parliamentary Secretary to the Minister of International Trade, Export Promotion, Small Business and Economic Development.
Thank you very much, Madam Speaker. It's a pleasure to join this evening's debate, and I want to thank the member from Yukon for initiating this very important subject matter that we are discussing today in the chamber. This is something that my constituents in Park Daylight Park speak to me regularly about, the issue of opioids, opioid use, and the opioid crisis that is claiming lives in Park Daylight Park, in Toronto, in Ontario, and right around the country. The deaths were occurring prior to any of us ever hearing about COVID-19. The deaths have continued through the pandemic, in some months exceeding COVID death rates, and these deaths unfortunately will likely continue once we have finished with the pandemic itself. So thus underscoring the urgency that we take action on this pressing issue. The history of what we have done as a party is something that was underscored just very recently in terms of this debate, which is treating the issue of opioid use and drug use generally as a health issue and not a criminal issue. Now, I wanted to turn back the clock a little bit, Mr. Speaker, and remind Canadians about where we were in 2015, prior to that election in the fall of 2015. We had a government led by Stephen Harper that was basically denying this health nexus, a government that was denying the ability of things like supervised consumption sites or supervised injection sites, as they were then referred to, from proceeding. The inability of that previous government in terms of granting exemptions under the relevant federal legislation to allow supervised injection sites to occur ended up in the Supreme Court of Canada in a case called Canada versus PHS Community Services. And in a 9-0 decision, which is somewhat rare for the Supreme Court of Canada, but a unanimous decision written by the Chief Justice, the court affirmed the constitutional rights that were at issue and sided soundly, unanimously, with the applicants in that case against the Harper government. And I'm going to read into the record part of what they said. In paragraph 136 of that decision, the court said, the minister made a decision not to extend the exemption from the application of the federal drug laws to Insight. Insight was the applicant seeking to run a supervised injection site. The effect of that decision, the court wrote, would have been to prevent injection drug users from accessing the health services offered by Insight, threatening the health and indeed the lives of potential clients. So there's the nexus, that by denying that ministerial exemption, the lives were threatened. The drug users' lives were threatened. The minister's decision thus constituted a limit on their Section 7 rights to life, liberty, and security of the person. The court went on to say this limit is not in accordance with fundamental justice. It is arbitrary and it is grossly disproportionate. And they said, and again I'm quoting here, the potential denial of health services and the correlative increase in the risk of death and disease to injection drug users outweigh any benefit that might be derived from maintaining an absolute prohibition. So there the court said, and again in a unanimous decision, that what you were doing by denying the ability to run a supervised injection site is you're threatening the lives, the very lives of these Canadians. That's what was so heinous about the approach of the previous government. And what happened in October of 2015 is that an election occurred, clearly. And we've had a different orientation on this side of the House since we've taken power. And what have we done since then, Mr. Speaker? What we've done is we got to work with approaching this as indeed a healthcare issue and an addiction issue as opposed to a criminal matter. We passed legislation in the 42nd Parliament, I believe it was Bill C-37 at the time, that prompted, rather than withholding discretion, we started to provide discretion, subject to the parameters that were outlined by the court in their jurisprudence. And supervised consumption sites then blossomed. Since 2016, the record of this government has been to provide 38 different instances of supervised consumption sites that are operating, granting the exemptions that have been required. Mr. Speaker, I have 10 minutes, I believe. You just give me a 1-minute signal. I have 6 minutes left. Right.
Stop the clock for a second just to make sure I don't want to take up too much of your time to make sure that we have it, but it's a 5 and 5. 5 statement, 5 questions.
So, Mr. Speaker, what I would indicate in terms of what we're trying to do is not only empowering supervised consumption sites, we're also taking a fundamentally different approach towards diversion, towards treating drug use differently, and what that comports with, and I'm talking about Bill C-5, which is tabled in this House, which I had the honor to speak to in December of this year in this Parliament, is that we are taking an approach that is endorsed by the Director of Public Prosecutions at the federal level in terms of the prosecution service, and the Canadian Association of Chiefs of Police, who've all said that rather than using police resources to criminalize people who are drug users, we should be approaching this from a different perspective, offering them treatments and getting them out of a revolving door role in the criminal justice system. That is the approach we have taken. Much more needs to be done, which is why participating in this debate is so critical this evening, and I'm looking forward to advocating on behalf of my constituents that want to see the needs of drug users attended to avert the concerns that we're facing now with the opioid crisis. Thank you, Mr. Speaker.
Questions and comments? The honourable member for Peterborough-Kawartha. Peterborough-Kawartha.
Thank you, Mr. Speaker, and thank you to the member for his speech. My question is around diversion and its effectiveness if there is nowhere to take the patient. Absolutely, we don't want to criminalize addiction. Absolutely, it's a disease. I think we've all heard that this evening. But if there's no resources and there's nowhere to take them and there's no bed and recovery center to take them to, how are we supposed to implement diversion tactics?
Great question. The Honourable Parliamentary Secretary.
I thank the member from Peterborough-Kawartha for that intervention, and I welcome her to this chamber. I'd say that's absolutely accurate. You need to both encourage diversion, but you need to have available resources. And what I think we're seeing on the part of our government is we're seeing dollars that are being committed, tens of millions of dollars, towards the treatment. We're seeing an appointment of a mental health and addictions cabinet minister as a first in Canadian history. That's the kind of emphasis we're placing on this issue in terms of cabinet appointments, but also in terms of the dollars that we're using to back it up, because we need to have the treatment systems and programs available so that diversion can be made to those very programs, and that's indeed what we're doing as a government. Merci.
Questions et commentaires, questions and comments. L'honorable député de Longueuil.
The honourable member for Longueuil-Saint-Hubert. Thank you, Mr. Speaker. It's a very moving evening. After having been touched by these stories, though, we need to arrive at solutions. Earlier, we talked about health. Clearly, this is a mental health problem, so it will take increases in health transfers towards the provinces. All solutions start with that. We talked about housing earlier. There are investments that have been lacking over the past 30 years because there is a strong link between homelessness and opioids or that crisis, addiction. There needs to be a community approach in Quebec for housing that has been admired across the country, but that takes money. But for example, if you have people who have problems with drugs, they need support after finding housing. Otherwise, they will be back where they started. So that takes overall community support, higher transfers, and so on. I think those are good solutions.
Je n'ai pas exactement entendu.
I didn't quite hear a question, but I will just raise the situation that he mentioned, the member for Longueuil. What I can highlight is that we are there to help, to assist, and work in partnership with the provinces that want to treat this situation as a health problem instead of a criminal justice system problem. We already talked about the expenditures and the funding we've provided. $66 million earmarked in the fall economic statement of 2020 towards this specific issue. Thank you. Questions and comments?
The Honourable Member for Vancouver East.
Thank you very much, Mr. Speaker, and I thank the member for his comments. The trip down memory lane with respect to the Harper administration and their approach to addressing the drug addiction issue has failed. The Supreme Court has struck it down, but now we're here in 2022, and it is within the Liberal government's authority to actually move forward and not adopt the approach that the Conservatives have taken, and that is by supporting the member from Courtney Port Alberni's private member's bill and to decriminalize to save lives. Will this member support the private member's bill and to decriminalize, and so that we can really move forward to save lives? He mentioned that he wants to do something for his constituents. He can by voting for that bill.
Parliamentary Secretary.
I thank the member for Vancouver East for her question. And what I would say on the issue of decriminalization is that we know that there are applications under Section 56 before the minister relating to the province of BC, the city of Vancouver, and indeed my city. We know that the public health officers in those two cities in particular have taken a strong stance in this regard. What I would say is that one of the things that we've been able to do as a government, because I'll juxtapose this notion that we are somehow following the Harper model, completely and antithetically we are not, is we are providing what is called a safe supply. We know that the majority of drug deaths are caused in the opioid context because people simply don't know what they're using and the potential dangers in what they're using. In my riding itself of Parkdale High Park, I was able to make an announcement of over $550,000 that is dedicated towards providing a safe supply to ensure that those who use are using in the confidence of understanding that what they're using is not laced with fentanyl. That is how you save lives. That is the approach towards harm reduction we've taken as a government, and those are the types of policies we will continue to pursue. Merci.
Resuming debate, reprise du débat, l'honorable député de Northumberland, Peter.
The Honourable Member for Northumberland, Peterborough South.
Thank you very much, Mr. Speaker. I might just say the member who was just speaking, I respect him tremendously, but I did not respect necessarily the tone of that speech. I think that I would love to see us work together collaboratively, and I think there could be no greater victory for our party, for our parliament, 44th overall. I mean this as a team, that we were to have a prolonged and permanent solution to the opioid crisis. And I would hope that all members would have that tone in conciliation and collaboration and not retell past of 7 years ago. But I rise today, like I said, on a very serious topic, Mr. Speaker. This opioid crisis is endemic. It is ravaging our communities. And my community, which is in rural Canada, is just as exposed as every other community. This is one of the largest public health crises of our times. Canada-wide, there are 17 deaths daily due to the opioid epidemic. 27,604 people were hospitalized with opioid-related poisoning between January 2016 and 2021. In 2020 alone, Mr. Speaker, there were 5,240 cases. And I'd just like to take this moment and just pause. Sorry, my apologies. I should have done this early. I'm going to split my time with the member from Pitt Meadows, Maple Ridge there, and I'm sure he's going to do a great job and looking forward to his discussion. What's more is when we talk about this, there is actually a direct connection between the pandemic of COVID-19 and the opioid crisis. We actually have seen a huge increase in the use of fentanyl. So analysis was done of major Canadian cities, Halifax, Montreal, Toronto, Edmonton, Vancouver. When the lockdown was put in place, literally just months after the lockdown, the use of fentanyl went up by 2 and even 3 times. People are hurting. People are in pain. They don't want to hear partisan bickering. They want solutions, and that's why I am here, and that's why I'm speaking today. And like I said, it hits right at home. In my riding, Northumberland, Peterborough South, we are covered by the Halliburton-Kawartha Pine Ridge District Health Unit. There have been 265 hospitalizations, confirmed opioid overdoses, and 9 more in January alone. But this doesn't tell the story. Numbers just don't carry it. That's literally hundreds, thousands of families across this community that have been ruined. That's promising young people. A person who could grow up and cure cancer and speak in this very house eloquently on whichever side of the aisle, their lives are ruined, sometimes beyond repair by these terrible substances. And like I said, there is nothing more that we could do as a 44th Parliament that would be more important than providing a lifetime cure. A couple of individuals in my riding I'd like to talk about. They've been outspoken on the front. Chief Vandergraaf, Paul Vandergraaf, a police chief in Cobourg, has been working and fighting the opioid epidemic every single day. He has talked about the fact that we need to not necessarily have police at the front line of this epidemic. We need to have therapists. We need to have doctors. We need to have community leaders ahead of on this. And Another individual I'd like to talk about who I respect deeply is Chief Lori Carr of the Hiawatha First Nations. She has made this a community effort to fight the opioid epidemic. She has gotten together therapists, she's gotten together knowledge keepers and had community meetings where they fight this person by person by person, trying to get as many people off of these horrible substances. But her work is being undermined. As a member from Peterborough said, it is being undermined because the nearest treatment center that will support Indigenous peoples is 6 hours away. Anyone who knows, anyone who's been touched by substance abuse in their life knows that when someone is willing to get treatment, they need it right now. Right. Too many people, Mr. Speaker, are left. They want help. They want to get better. They want their families to be better. But they can't because they don't have the resources they need. And quite frankly, we need them now. And that's why I'm so proud to rise on this. And like I said, I beg every member in here to make this a top priority, and let's have a prolonged, lasting solution to this horrible, terrible crisis. Thank you, Mr. Speaker.
Question commentaire, question and comments. The honourable member for Winnipeg North.
Thank you, Mr. Speaker. I can appreciate, given the very nature of what it is that we're talking about, that there's a great deal of passion and emotion. We're talking about life and death matters. As I had pointed out to his colleague, all of us, all 338, including the Speaker, can actually cite examples, and it's endless, the numbers that are there. And I would ask the member to also reflect on the same question I had asked his colleague, that as much as the federal government can play a significant role, many, including myself, would say even a strong leadership role, the best way for us to overcome this issue in order to help it go away or minimize it is when we get all of the different stakeholders coming together. And I listed a part of them, whether they're governments, first responders, nonprofits, and so forth, and his thoughts on that.
The honourable member for Northumberland, Peterborough South.
No, and absolutely, and I agree with his comments. I would even widen the audience or the interactions we need to have, and you know what, including we need people who have battled through addiction, and even people who are engaged in the battle against addiction. There should be nothing about people without them. And so we need to bring all people to the table. But you know what? We can't wait. We need action. This crisis is now decades old. It's decades in the making. We need someone, a family who's dealing with someone who's being addicted, to know where to go, when to go to get help, and to get help for all Canadians.
Questions and comments. The honourable member for Courtenay Alberni.
Thank you, Mr. Speaker. First, I want to thank my friend and colleague from Northumberland, Peterborough South, for his passion and compassion. Mr. Speaker, he talked about the lack of supports for treatment. Clearly, that's an issue, and I'm really glad to see the Conservatives advocating for that. About 15% of people that are suffering with opioid disorder, with addiction, want to get treatment. But people can't access treatment if they're dead. And, Mr. Speaker, we're dealing with a poison drug supply. Now, I'm glad to hear the Liberals talking about a safe supply, but they need to scale it up rapidly. We've heard from the experts that the politically courageous answer is full decriminalization, regulated safe supply, record expungement, treatment on demand via a public health system, prevention and education. Now, Mr. Speaker, these are things that are going to make a lot of us uncomfortable. It's going against societal norms. But as my colleague says, we've got to do things differently. Is he willing to have the courage to step out and do things differently to save lives? This can't be about votes. We got elected to do the right thing, to listen to experts, and clearly people are dying, 20 people a day, Mr. Speaker. We need to move rapidly.
Honourable member for Northumberland, Peterborough South.
I think the member, and I'm willing to discuss all options are on the table. As you said, as a member said, Mr. Speaker, people are dying, so all our options are on the table. I will say that ultimately my dream would be to have a Canada where no one is using these substances, and not just managing the crisis, but actually overcoming it. But I'm open to let's have discussions, let's work it out, and always enjoy the members' collaborative approach.
Et commentaire, l'honorable député de...
Questions, comments? The Honourable Member for Berthierville-Maskinongé. Thank you, Mr. Speaker. I'm delighted to hear my colleague say that he's open to all proposals. I hope that includes decriminalization. That's not in the usual practices of his political party. I'd like to hear him on the importance of increasing health care transfers, Canada Health transfers, and the increase in necessity of increasing funding in social housing. Both are directly related to this crisis. It's so important to increase the money. Quebec and the provinces are the ones in charge of health and spending that money.
Thank you very much. And it is astonishing. I will say that throughout this pandemic, that the government doesn't appear to have even contemplated to having increasing transfers, health transfers. One of the pressures on our system has been, of course, COVID-19, but we also are in many cases lacking the sufficient ICU beds and hospital beds that we need. And so, like I said, always open to collaboration and to discussion.
Resuming debate,
Resuming debate, the Honourable Member for Pitt Meadows, Maple Ridge.
And it's good to be here this evening to share some thoughts, and I do want to thank the members from all sides on this very important issue, something that touches us here and Canadians from coast to coast to coast. We probably all know people, loved ones that have been impacted through drugs or overdosing or dying. So in British Columbia, where I'm from, 2,700 people have died from COVID since the pandemic began. During that time, almost 3,700 have died through the opioid crisis. That's 1,000 more people than from COVID. Like, it's very serious. COVID is serious, but this is a very serious issue that is impacting. And since 2015, we've seen almost a 500% increase in British Columbia in drug deaths from 400, now approaching 2,000 people. It is a crisis. And opioids can be unforgiving. They, one hit and you're dead. And I know different ones who have died. I think of a young woman, a beautiful lady who had a child, and she's very outgoing, friendly. She was a bridesmaid in my niece's wedding, and then just the next I heard she had died. Her and her boyfriend had died. And it just can hit so quickly. Been to thousands of doors in the past couple of years, 3 years, and I don't know how many people I've met who have lost loved ones through this right here. December 14th, 2021, there was a Canadian press story. In it, it's quoted Dr. Nell Wyman, who is a Deputy Chief Medical Officer in one of the BC health authorities. And in it, she says that deaths were declining in 2019, but the lockdowns forced people into isolation and more people used drugs alone. And one of the unintended consequences of the public health measures related to the COVID pandemic and has exacerbated the toxic drug events and deaths. And that's difficult. For example, in February 2020, there were 78 deaths in British Columbia. And then March, when COVID struck right there, we had 119. This is COVID deaths, or not COVID, this is the drug overdoses. April, 128, May, 187, July, 185. And so people are dealing with mental health. That is a big issue, and it's leading to people going to drugs. They're feeling isolated. I talked to the RCMP superintendent in Ridge Meadows Detachment and said the number one issue is mental health. And the opioids are part of, and the crisis goes in hand with mental health. I'm Indigenous, Métis, and it's very troubling to hear that there are 5 times Indigenous people are 5 times more likely to die from not to die, but to overdose, and 3 times more likely to die from an overdose. It's a terrible situation. Last spring, I presented a motion to look at into a framework for addiction recovery. And I think that is something we need to look at, because what we're doing right now isn't going the right direction. We need to do something more. And there has been a real lack in the area of investment into recovery programs. And I've visited some recovery places in my constituency. I think of Tiffany. And when I talked to her, she told me that after being an addict for 20 years, they had given me the tools I needed to love myself so I can go home, be the mother that my children need. Another young woman told me that she had been addicted to drugs and supported her habit through prostitution. She told me that she would be dead if it wasn't for the help that she was now receiving. It's Joanna, she's a manager of Hannah House in my riding, and she said that there's a lot of money that is being spent helping people to stay sick and addicted. And I know that she said, it's heartbreaking and it's important, it's essential to keep people alive, no doubt about it. But how about finding a way to truly find them to be able to live? And that's it. We want to keep people alive, but we want them to have a life. And that is where recovery comes in. We need a lot more investment in this at the different levels. And I asked her, why was there so little funding from government, from her perspective? And she said that abstinence-based recovery was not really politically correct. So it was interesting. So thank you, Mr. Speaker.
Questions et commentaires, questions and comments. L'honorable député de
Thank you very much.
My colleague for his speech, and particularly when he speaks about the Indigenous Canadian in his province. It's true that the opioid crisis continues to have a disproportionate impact on health and well-being of Indigenous people. We are investing $425 million annually for community-based services to address the mental wellness needs of First Nations and Inuit. So I would like to know if my colleagues agree that those investments will help make it easier to access medication, and makes it easier too for overdose prevention sites to be rapidly established and respond to immediate COVID-19 needs in communities. Thank you.
The honourable member for Pitt Meadows, Maple Ridge.
Thank the member for her question. And I think, yes, investments for sure. But she used the word medication, and I believe that is word for giving them drugs, whether methadone or other drugs. And I think that the objective needs to be seeing people actually recover, fully recover from that, to help them to move along right there too. And that takes a tremendous amount of work, and it is mental health, there's all sorts of different things. It's not a simple solution. And I do think that we do need to come together. What are some ways? But I believe that recovery has to be at the forefront.
Les commentaires, questions and comments. L'honorable député de...
The Honourable Member for Longueuil-Saint-Hubert. Thank you, Mr. Speaker. In my riding, there's a resource for homelessness that opened during the pandemic, and I imagine that's been the case elsewhere in Canada since the pandemic began. It has hit us so hard. What we're hearing tonight is that the pandemic has affected mental health and opioid use across Canada. It's created people who hit hard times and began to use opioids. Now, these resources for homelessness need to be supported, and yet there's no more money planned to help keep this resource open. The money that has been spent on homelessness should be renewed after March 31st.
Oui, j'aimerais remercier le...
I'd like to thank the member for Longueuil-Saint-Hubert. He is wondering about options. I believe that this resource is necessary. The pandemic has affected countless people, and as I mentioned, people have died from this pandemic. One person told me at this Les Retrouvailles resource that some people in the street received money that they perhaps shouldn't have received, and they were negatively impacted by this. That's what she told me, that many people were impacted in this manner.
And comments, question et commentaire, the honourable member for Port Moody Coquitlam.
Thank you, Mr. Speaker. And I just wanted to say to the member from Pitt Meadows, Maple Ridge, my neighbor, that I know how deeply this affects your community, and I know how hard you and others, elected officials in your community, are working, through the chair I should be saying this, how hard you are working to make sure that people are housed and cared for in Pitt Meadows, Maple Ridge. The other thing that the member and I share is the reality that the opioid crisis is responsible for the declining life expectancy of men in the province of British Columbia. And we know much of it is related to tradespeople. Unfortunately, tradespeople don't have access to the care they need, the health care they need, the doctors that they need to deal with the pain that they are dealing with every day. So I guess I just wanted to extend my wishes to the member that our communities remain healthy, and also to ask the member if they would support the bill from my colleague from Courtenay, Port Alberni, in relation to small amounts of possession to decriminalize it, so that those that are working, that are trying to work through pain and trying to work through any type of opioid addiction, are not at risk of losing their employment.
Member for Pitt Meadows, Maple Ridge, and a short answer.
Yeah, thank you to the member for her comments. And yes, we're just right across the river from each other. I know one of the organizations that in my riding that is helping those to recover is Hope for Freedom. I know there's also facilities in hers and doing a great work. And that gives me hope to see people's lives change, to be able to come out of this way. It does give me that hope. And so I'm happy to work with her. Yeah, as far as the Conservative position, we are not for trying to go after the small drug users or anything like that, but it's more those that are in distribution and in pushing in a large scale. So that would be our focus. And so I'd have to look at the bill before I could really comment further, but I do thank you for the question. Thank you.
Resuming debate, the honourable member for Vancouver Grenville.
Thank you, Mr. Speaker. And I will be sharing my time with my colleague, the member for Kitchener Centre. Mr. Speaker, I appreciate the opportunity to speak on this very important issue that has tragically touched so many lives right across the country, and of course in my riding of Vancouver Granville. You know, British Columbia has been seized by the opioid crisis, as we've heard from other members. It doesn't matter whether you're rich or poor, urban or rural. Likely you know someone who has either lost their life or been touched in some way by this awful crisis. The impact of the opioid crisis is devastating individuals, families, and communities. And we all know it's gotten worse through the COVID-19 pandemic, with isolation, stress, reduced access to services, and toxic supply now entering the mix. So as a result, we've seen a 74% increase in opioid-related deaths during the first 6 months alone of the pandemic. You know, when we think about the opioid crisis, too often we fall back on stigmatized characterizations of people who use drugs. Well, Mr. Speaker, the ongoing effects of the opioid epidemic are pervasive. These overdoses are claiming the lives of thousands of Canadians of all walks of life, of all ages, from all walks of life. And we continue to hear so many devastating stories from people who have lost a loved one to this epidemic. You know, I heard these stories from my more than 10 years as a volunteer and a board member at Covenant House in Vancouver, but I've heard them from my constituents, but their loved ones, whether they're doctors or lawyers or teachers or kids. And to this day, I'm absolutely haunted by the stories of young people for whom the possibility of death from an opioid was just all in a day's living. But I was also moved by the desire of so many who were desperate for a way out that meant that they could get clean and stay clean and not worry about dying in the process. So for me, these young people, those who survived and those who did not, continue to be a reminder of why we have to act. But those who were impacted by the opioid crisis still remain stigmatized by the public, and the stigma remains a huge barrier in ensuring that people who use drugs can receive safe, culturally competent, and trauma-informed care. Harm reduction, safe supply, addressing this as a healthcare issue is what we must do. And Mr. Speaker, substance use is a health issue that requires care and compassion like any other health condition. It requires vision like that which was shown by Vancouver's late Mayor Philip Owen and his four-pillar approach to addressing Vancouver's drug crisis. The four-pillar approach reflected a comprehensive approach to the opioid crisis, to the drug crisis, really, by treating it as a public health issue and not solely as a law enforcement issue. Instead, it involved a mix of prevention, enforcement, treatment, and harm reduction. This approach was critical in changing the shape of how Vancouver approached the drug crisis in the early 2000s. And now, almost 20 years later, we know that there's lots more work and collaboration that we need to put into place. But we know that harm reduction saves lives, and we know that we need critical action immediately to reduce the harms of the worsening toxic drug supply. Now, it's often said that Canada's opioid crisis started in BC, and it's got to end in BC. Now, I'm proud of the work that we've done to date. In 2017, my colleague from Coquitlam, Port Coquitlam, introduced the Good Samaritan Drug Overdose Act, which provided limited legal immunity to those bystanders who called for help if they witnessed an overdose. Now, since 2017, supervised consumption sites across Canada have received more than 2.9 million visits, which have reversed nearly 27,000 overdoses without a single death at a site. So we know that supervised consumption sites save lives by providing a safe, clean space for people to bring their own drugs to use and to be able to test these drugs safely. Now, Mr. Speaker, to continue to effectively address this crisis, we know that we have to collaborate with all levels of government in effecting a meaningful response. And as we move forward in addressing this crisis, we know that a comprehensive, collaborative, compassionate, and evidence-based approach is what is going to work to end this national public health crisis. We have to consider all options, safe supply to drug checking, to stop this unending and preventable loss of life. We have the chance to lead, Mr. Speaker, on ending once and for all the heartbreak and devastation that is caused by this opioid epidemic. We do this by working with communities, law enforcement across all levels of government, and above all else, by keeping in mind that this is about saving the lives of our fellow Canadians. And that, Mr. Speaker, should be reason enough to act. Thank you.
Question commentaire, questions and comments. The Honourable Member for Sherwood Park for Saskatchewan.
Thank you very much, Mr. Speaker. I thank the member for his remarks. And I want to probe one aspect of his speech. He talked about the issue of safe supply, and other members have talked about safe supply policies. And I know that the term safe supply can be used in some different contexts. So I would support, for instance, providing substances like Suboxone that can be used in the context of treatment. Suboxone can help to treat opioid dependency. It's also has the benefit of being quite tamper resistant. And I would also support allowing doctors to provide, have the discretion and flexibility to provide prescriptions to patients in the context of understanding their own situation or their own health needs. That could be considered a form of safe supply. What I would not support is a policy whereby a broad range of dangerous drugs were made more easily available outside of a context with a treatment and supervision of a physician. So I wonder if the member could clarify what kinds of safe supply policies he supports. Is he talking about care of physicians making substances like Suboxone more available, or is he talking about just a general policy of government funding and increasing the availability of dangerous drugs?
The Honourable Member for Vancouver Granville.
Well, I thank the member for his question. You know, I think we have to work with the provinces and the cities where we're going to be putting this in place to understand what makes the most sense. There's lots of opportunity for us to look at SUAP, the Substance Use and Addictions Program, ways in which we can direct funding from there to work with physicians to deal with safe supply. There are so many options available to us, and I think we need to explore all of those options. And I know the minister, that is dealing with mental health and addictions has spent tremendous amounts of time and effort looking into this, and I think we can come up with solutions that work to serve Canadians in the most meaningful way possible, and hopefully with the support of all in this House.
Commentaire, the Honourable Member for South Okanagan, West Kootenay.
Well, thank you, Mr. Speaker, and I'd like to thank the member from Vancouver Granville for his speech. He talked about how he had listened to the stories of people struggling with addiction. I know some of the most moving stories I've heard from my constituents have been from people who have struggled with addiction. Some of them have overcome it and are back with their families, forming new families. It's so moving. And he outlined some of the paths that we have to take to get people to that get them to that place. And I'm just wondering, my colleague from Courtenay Alberni has tabled a private member's bill, C-216, that will be debated here very shortly, that will tackle each of those things. It will tackle decriminalization of small amounts of drugs, and it would form a national strategy with the provinces to talk about dealing with the harmful medical effects such as safe supply. I'm just wondering if he will support this bill.
The honourable member for Vancouver-Granville.
Well, I thank the member for his very important question and for his advocacy on this issue. You know, there are many elements that we have to consider. I think working with the provinces is key. Working with the cities in Vancouver and British Columbia have already put in applications for exemptions. These are things that are tangible things that we can put into place right away. So I think all of these opportunities are ones for us to take up in partnership with the province and the cities. That's how we're going to get this done. That's how we're going to make sure that we are addressing these issues in all the different ways that are required, from ensuring that there is safe supply, all the way to ensuring that there is wraparound care for mental health and addictions, all of which are interlinked in many of these situations.
Les commentaires, questions and comments. L'honorable député de Beauport-Limoilou.
The honourable member for Beauport-Limoilou. Thank you, Mr. Speaker. I come from the education sector. In Quebec, the school boards need and are required to provide and come up with action plans, for example. We need to also provide how we're going to get results and who is responsible for all of the actions. We have all kinds of solutions. Isn't it time we implement them?
Member for Vancouver-Granville.
Merci, Monsieur le Président. Oui, bien.
Thank you, Mr. Speaker. Yes, of course. That's why we are working together, and we need to do that with the provinces. We are trying to find how we can work with the provinces and even the cities that are impacted by this crisis. We need to work together to find solutions and to respond effectively to these issues.
The honourable member for Kitchener Centre.
Thank you, Mr. Speaker. I want to start by saying thank you to the member for Yukon for his leadership in ensuring we have this conversation this evening. Such an important conversation to come back to the critical need for us to save lives in the midst of a poisoning crisis. When we talk about that crisis, I want to share that in Waterloo Region alone in 2021, it's around 155 overdose poisoning deaths. As a baseline, to give you a sense, we had 145 deaths from COVID-19 in Waterloo Region. And as many of you also know, it's on average now 19 deaths a day across the country. For those in this place that like talking about the economics of decisions that are made here, in 2017, we spent $6.4 billion on policing, courts, and correctional costs with respect to criminalized substances. And so tonight and often, I've heard many folks say that this should be a public health matter, not a criminal justice one. And I could not agree more. The good news for that, though, is we have advice for all parliamentarians on how to ensure that our legislation reflects that, because the fact is today that that's not true. It continues to be that we are criminalizing unregulated substances across the country. And so, to do that, I would encourage all parliamentarians to review the expert panel's advice from Health Canada on substance use. And this is why I'm so supportive of the member for Courtenay Alberni's private member's bill, because it is taking a roadmap from this third-party advice to move towards legislation that would do exactly that, that would treat this as a matter of public health. And because it's a crisis, which I think every speaker this evening has shared that view. We should move forward with the urgency it deserves. That's the reason why I'd encourage all parliamentarians to support this private member's bill. And specifically in doing so, that bill includes recommendations from the expert panel, including decriminalizing of simple possession of unregulated drugs, expunging or wiping clean the records of folks so that they don't have that discrimination throughout their lives, and for a national strategy that would include low barrier access to a safer supply. As we do that, I also want to point out the need, and it was mentioned again from the task force, the need to be talking about the social determinants of health, while we also directly need to address the poisoning crisis we are in. Because we know that those that are addicted to unregulated drugs currently, that is heightened by the lack of access to quality, dignified, and affordable housing. It is heightened by the lack of truly universal health care across the country and the lack of proper income supports. With my final time, I'd love to share a quote from a frontline worker in Waterloo Region. This is Alice, who works at the Sanguine Health Center, who supports and works with people every day who are on the front lines of this crisis. And so her words are this: regardless of the political climate, we are going to spend every minute of our day caring about people who use drugs, honoring their lives, their perspectives and their expertise, and advocating with them when their needs are not met. We will continue to build and create relationships that are based on mutual respect and love, and walk with people in their times of joy and in their times of heartbreak. We will remember each life that has been lost in preventable overdose deaths as the vibrant, complex, and beautiful spirits that they were instead of cold statistics. And we will continue to refuse to accept the status quo, that people who use drugs are considered less important than other people in our communities. We will proudly declare to anyone who's listening, and many who aren't, that people who use drugs are a welcome part of our community, not people happening to our community, just as we have every day for many years. Thank you.
Commentaires, questions and comments. L'honorable député de Sherbrooke.
The honourable member for Sherbrooke.
Thank you, Mr. Speaker, and I thank the colleague for his speech. He mentioned that a lot of money has been put in the justice system. We introduced legislation that, among other measures, will require police and prosecutors to consider non-criminal responses to some drug-related offenses. I'd like to ask my colleague if he agrees that alternatives to prosecution should be considered for simple possession offenses.
The honourable member for Kitchener Centre.
Yes, thank you for the question from the honourable member for Sherbrooke. I do. And to go a step further, that I believe we recognize that mandatory minimum penalties, we know, as has been called out in the Truth and Reconciliation Commission, need to be moved away from. And so I would actually encourage the governing party to go further with that legislation to ensure that we follow through on the calls to action from the TRC. Thank you.
And comments, questions et commentaires. The honourable member for Sherwood Park for Saskatchewan.
Thank you, Mr. Speaker. And I want to very strongly agree with the aspect of the member's speech where he talked about affirming the immutable human dignity of everyone in our society, of recognizing that those who suffer from substance use disorders needed to be greeted with love and care and empathy. Many members of the government, this member as well, spoke about advocating for the further liberalization of drug laws, decriminalization. Some members, I know, support full legalization. I think one of the problems with these arguments is that they don't take into consideration the fact that in certain contexts in Canada, we already have practically very liberalized drug law realities at the local level. The reality, for instance, in the downtown east side of Vancouver is not formal legal decriminalization, but effective legalization as well as a concentration of services. It just isn't working. If you look at the regional context where there was a practical liberalization of drug laws, we continue to see very high levels of of overdose deaths. So I wonder if the member, I don't agree with him, but I would ask him to explain further why he assumes that further liberalization is going to solve a problem which it has not solved up till now.
The honourable member for Kitchener Centre.
Yeah, thanks for the question, and the tone with which the question was asked, it sounds to me like a place of genuine curiosity. And my perspective is to follow the expert advice that parliamentarians are being given, and that expert advice from the Task Force on Substance Use shares very clearly the need to not only move away from criminalization, but alongside other recommendations, many of which are reflected in Bill 2616, ensures that we would not only save lives, but better take care of people across the country.
J'essaie mon mieux de représenter tous les partis dans la période de fitting in here. The honourable member, l'honorable député de Longueuil.
The honourable member for Longueuil-Saint-Hubert. Thank you, Mr. Speaker. Oh, your feed is cutting. I think it's your internet that's not working very well. You may restart your question. Can you hear me now? Yes? Yes, that's better. Great. Thank you very much. Thank you to my colleague. Yeah, we talked about a lot of things tonight. I retained 4 ideas. The decriminalizing, sorry for my pronunciation there, it's a bit late, inaudible. Something about health also. And also there needs to be more investments in housing. What are my colleagues' priorities? Thank you to my colleague for Longueuil-Saint-Hubert. My priority is the bill that is before us today, and that is Bill 216. That will
right? A mix of policies, and so we don't need to choose one over the other, but we have in front of us a bill that would allow us to do a mix of what experts are already calling for.
Questions and comments? The honourable member for South Okanagan, West Kootenay.
Well, thank you, Mr. Speaker, and I'd like to thank my friend and colleague from Kitchener Centre for his speech. I just wanted to pick up on some of the barriers that these people face. They face many barriers, but when I talk to people that work with people struggling with addictions in my riding, my hometown of Penticton, places like Discovery House, Pathways, Mothers Stop the Harms, one of the big barriers is that stigma, the stigma that many people have against people struggling with addiction. And I had the opportunity to have dinner with the Consul General for Portugal last summer, Marta Cowling, and we talked extensively about Portugal's experience with this. And one of the big successes in Portugal when they decriminalized possession of small amounts of drugs was this great reduction in the stigma. When we still have something that is criminalized here, these people are seen by many people as criminals, and they're not. They're people struggling with a medical condition, and I just wondered if my colleague could comment on that.
30 seconds for a short answer for the member for Kitchener Centre.
Thank you. The 3-word answer is we need support, not stigma, and we need to recognize that this is part of a vicious cycle, that the stigma is part of why we need to move towards decriminalization. That's what helps us move away from this as one of the 5 core challenges that same task force called out as we move towards decriminalization. Thank you.
Reprise du débat, continuing debate, l'honorable député de...
Resuming debate, the honourable member for Rivière-des-Mille-Îles. Thank you, Mr. Speaker. I'm truly delighted to be taking part in this debate tonight, despite the late hour. We're here tonight to discuss a very important public health issue, the opioid crisis. This debate is in response to the February 4th notice of a motion by the member for Ajax, that a take-note debate on the opioid crisis in Canada be held on Tuesday, February 8th, 2022. The opioid crisis is not, I believe, a particularly divisive issue among parties. Everyone in this room, rather, wants to stem the crisis, but we have different solutions to solve it. What the Bloc Québécois is proposing is a decriminalization process of simple possession accompanied by frontline health services. Let's first define what we're talking about. The term opioid refers to substances, natural or synthetic, that act through one of the three main opioid receptors located in the central nervous system. Whether ingested or injected, these substances can have both an analgesic and a depressant effect. Some relatively well-known opioids, just to make sure we're talking about the same thing, are oxycodone, morphine, hydromorphone, fentanyl, codeine, heroin, methadone, etc. Whether prescribed or not, these drugs are ones that cause our tolerance to increase over time. We must therefore potentially increase the dose to feel an effect. This increase goes hand in hand with a psychological and physical dependence that can lead to overdose. Since 2016, deaths attributable to opioids in Quebec and Canada have risen from 3,000 in 2016 to over 6,000 in 2020, so a doubling of the number in 4 years. And the statistics are similar in the U.S. This is huge. It's sad. It's unacceptable. While this crisis is now felt from coast to coast, unfortunately, Quebec has historically been spared, lightly spared, compared to the Western provinces and Ontario. And I'm not trying to be pretentious here about Quebec. With foresight and wisdom, Quebec did not wait for the crisis to reach national proportions before taking action by establishing its national strategy to prevent opioid overdose. That was a 2018 to 2020 strategy. This strategy was based on, among other things, compiling reliable data scientifically, raising awareness and providing information, access to integrated and responsive services, and prevention. For example, Quebec has been successful in reducing overdose mortality by providing free and universal access to naloxone, an opioid antidote, and by ensuring that first responders can administer it. To anyone who is undergoing an overdose. Quebec has established supervised injection sites. We completely agree with this idea at the Bloc Québécois, and these sites come with a myriad of benefits. The opportunity to reach vulnerable populations, the reduction of overdose deaths, reduced health risks, and better care for drug users, as well as other benefits. Let me just emphasize, the Bloc Québécois considers injection sites to be a powerful tool in the fight against the opioid crisis. We ask that the federal government not interfere with Quebec's drug access policies. We currently have the situation under control in Quebec, even if our mortality figures are not what they should be. They are still better than what we find elsewhere. So please let us do our work based on our jurisdiction. Opioid-related overdose deaths are common. In the vast majority of cases, these are drugs purchased illegally on the street, such as fentanyl mixed with heroin. This is why the Bloc Québécois is advocating the decriminalization of simple possession of drugs, along with frontline health care. In concrete terms, this means that an individual arrested for simple possession of heroin, for example, could undergo training, detoxification, or other appropriate measures in exchange for having his or her charges dropped. These people must be treated for what they are, drug addicts and not dangerous criminals. Mr. Speaker, I'd like to remind you that in the past, my training is in criminology. By giving, with this method, we would allow people to treat their addiction and not send them to crime school. And we could kill two birds with one stone, alleviate the crisis in the judicial and prison system, and at the same time help drug users recover from their addiction. We're not talking about criminals, we're talking about people who are drug addicts. Let's focus on remission rather than punishment. I think everyone here will agree that the opioid crisis is not a crime issue, but rather a public health issue. That's why I would like to repeat the word public health, which is so important in this speech. You probably guessed where I'm going with this. The 1867 Constitution tells us that health is a shared jurisdiction between the provincial and federal governments. The role of each is quite clearly defined. This Constitution gives the provinces responsibility for, among other things, healthcare services, the practice of medicine, professional training and regulation of the medical profession, hospital insurance, health insurance, occupational health, and so on. That's the responsibility of provinces. It's therefore clear that Quebec has responsibility for the delivery of the vast majority of prevention, treatment, and harm reduction programs for a public health crisis such as opioids. In contrast, the federal government can fund research, implement initiatives, and so on. Quebec is therefore asking for a 6% increase, and asking that health transfers be increased to fight this opioid pandemic. My Jonquière colleague said yesterday that there is a price to pay for chronic federal underfunding in healthcare. There's a price to pay for maintaining a healthcare network stretched to the limit. And today it is Quebecers who are paying this price. The Liberal government must absolutely acknowledge this consensus and sit down with its provincial counterparts to discuss it. Thank you, Mr. Speaker.
Questions and comments. L'honorable secrétaire parlementaire de la ministre de Santé.
The Honourable Secretary for the Minister of Mental Health and Addictions. Thank you, Mr. Speaker. Thank you to my colleague for his speech. Does that mean he agrees with Bill C-5, a bill that will eliminate policies that have filled up our prisons with people who, in fact, need help, and targeted vulnerable Canadians? Answer. Thank you very much for your question. I completely agree. I am a humanist. I'm a criminologist by training. Our prisons are filled with people. For example, in Quebec, 1 out of every 2 people are filled with prisons because of drug possession. We need to filter out these people and help them. They're not criminals. They are people who need our help. Thank you.
Comments, the honourable member for Sherwood Park for Saskatchewan.
Merci, Monsieur le Président.
Thank you, Mr. Speaker. My colleague raised several important points. The access to naloxone. I'd like to learn the Bloc's viewpoint on the responsibility of businesses that invented this crisis, McKinsey, Sackler, etc. Does he agree that the government should demand compensation from these businesses and use this resource to increase funding for treatments? The honourable member for Rivière-des-Mille-Îles. I'm not sure I understood my colleague's question properly. If we inject money into the healthcare system and if we need to inject money and are unable to respond to needs, then yes, we need to do something. But I'm not sure that I understood exactly what he was asking. I'm sorry. Questions and comments?
L'honorable député.
The honourable member for Berthierville-Masquinongé. Thank you, Mr. Speaker, and I'd like to thank my colleague who very clearly demonstrated that there is a consensus on the need to decriminalize possession. As for the question of healthcare transfers, I won't discuss this for now, but what about the link between social housing and the opioid crisis? What can the federal government do to help? I'd like to hear him on that question. The honourable member for Rivière-des-Mille-Îles. Thank you very much to my colleague for his question. If I had more time, I would have been delighted to take a few minutes to respond to my colleague who's in charge of social housing for the Bloc Québécois. The Bloc Québécois is demanding that 1% of federal income be injected into these programs. There are enormous needs in social housing, but when we're discussing a subject such as the one we're discussing tonight, there are very clear links to be made. That is, there are vulnerable people with needs who are stuck with these addiction problems and who are in the street. They are part of the homeless population. They are people who need social housing. They are among the most vulnerable. And this 1% is therefore a priority for the Bloc Québécois. We will continue to demand that it be invested.
And comments, the honourable member for Port Moody Coquitlam.
Thank you, Mr. Speaker, and thank you to the member to speak about the compassion that we need to show in this crisis. So I agree with the member wholeheartedly on the need for increased healthcare transfers to provinces. And I just wanted to confirm tonight that I think we also agree on decriminalizing those small amounts of personal possession. So I just wanted to ask the member if they will support the Bill 216 from my colleague from Courtenay Port Alberni to decriminalize simple possession.
L'honorable député.
The honourable member for Rivière-des-Mille-Îles. Thank you very much to my dear colleague. Yes, it's compassion, but more than just compassion. My speech tonight is based on science. We have two parties that are debating. They're pro-science. My studies, my training led me to science, not of course, absolute facts, but science that helps steer us towards satisfying answers. Yes, compassion then, but compassion based on facts. There is no justification to criminalize people who are in need. Do we put alcoholics in prison? Do we put chronic drug addicts in prison? Well, perhaps we do. And if you add crime to the mix, then yes, they end up in prison.
The honourable member for Mississauga, Aaron Mills.
Thank you very much, Mr. Speaker, and thank you to the member for his very impassioned speech. There's a number of different schools of thought about how justice should be conducted and how we should, conduct our society. And I wonder if the member can maybe share some of his thoughts around how mandatory minimums impact those that are suffering, those that are, going through the opioid crisis and are in need of support. So perhaps the member can share his thoughts about mandatory minimums and the role of the justice system as opposed to the healthcare system when we talk about matters like these.
The honourable member for Rivière-des-Mille-Îles. Our healthcare system in Quebec and the systems across Canada are unfortunately overburdened for various reasons. The opioid crisis is one of the factors that's very clear. If we could indeed receive reasonable health transfers that are sufficient for our needs and what we deserve, and I wish that for all of the provinces, all of the populations, if we had 35%, then we could better respond to needs. We could perhaps be more sensitive to the cause of people who are facing drug addictions. This is not, they are not criminals.
The honourable member for Sherwood Park for Saskatchewan.
Thank you, Mr. Speaker. I just wanted to follow up to clarify my earlier question because maybe my French wasn't as good as I thought it was. The issue that I wanted to raise and get the member's perspective on is that we know that the opioid crisis was, on some accounts, started, certainly fueled by certain companies such as Purdue Pharma and others that presented misinformation about the risks of addiction and really aggressively over-promoted opioids as being the solution in many cases where, in fact, there wasn't evidence to suggest it, and there was a lack of acknowledgement of the risks that they should have been, and in many cases were aware of. Now, many of those companies have been required to pay compensation in the United States, and that compensation is being used to fund treatment. Purdue, the Sackler family directly, as well as McKinsey, who advised Purdue, have had to pay, and that has provided some increased resources for treatment. The Canadian government has been far behind in pursuing that kind of compensation and accountability. So does his party agree that the government should be doing more to pursue accountability for bad corporate actors, and maybe that could provide some additional resources that we can use for treatment?
The honourable member for Rivière-des-Mille-Îles. Thank you. It's quite a bit clearer this time. I'm sorry. It might have been my understanding. All of my apologies. Listen, there are abuses even every time money is involved. Pharmaceutical companies are able to target the weaknesses and the needs of people in an extraordinary way. In this current issue, well, sure, they do have to answer to what happened, and it might be the same thing for COVID. There might be some companies that overcharged for certain doses of certain things. I believe that a responsible government will have to respond on a regular basis to all these kinds of issues. That way, we'll clearly know what's happening, and as citizens and in parliamentarians, we'll be able to do our jobs. Seeing that it being 10:44 p.m., this House stands adjourned.
We're doing cleanup. This House stands adjourned until tomorrow at 2 p.m. pursuant to Standing Order 24-1.